So good morning to everybody. So it's already 9 o'clock, so we have a tight agenda for today, so we can start again. And I could start with a wrap up of the previous session and also introducing the session for today. I hope that you can see my screen.
Yes.
So
yes,
let's start with the key elements for the discussion today. I will try to address some of the questions that we were assessing yesterday afternoon with the colleagues. First, the guidance for the technical requirements of for particles is a guidance for conventional materials. We are not saying if you need to use the guidance, that do not mean that you are producing and engineering nanomaterial. Is not connected at all to the definitions or to the easy recommendation for nanomaterials or the nanoforms. The definition for engineering nanomaterials in the Novel Food Regulation. We are talking about conventional materials, but these conventional materials, we need to be sure from the risk assessment perspective that are safe. And the question is that these materials may contain a fraction of nanoparticles. And in the case that these materials contain this fraction of nanoparticles, even they are still conventional materials, the definition does not apply if the material do not have the properties that are included in the definition. But nevertheless, we need to be sure that in the safety assessment conducted by EFSA, we are covering as well this fraction of nanoparticles. And based on that, include a set of thresholds that are based on the safety for the consumers, which is I will assume, and I really hope that is the common goal of everybody that is following this discussion today. So there are risk assessment principles based on consumer safety, are not linked to specific definitions, do not mean that you need to consider that your material is not a conventional material, but there is a fraction. And if that fraction is there, the fraction may have different properties. So there is obviously the need to address that fraction in the safety assessment. And also, it's not the read across. Is for those that are not that are more familiar with normal chemical assessment, is the same that if you have a mixture with two components, you need to be sure that both components in the mixture are assessed for the safety as are considered in the safety assessment. Exactly the same principle. The chemistry can be the same, but because of the properties of the particles at these sites, the very high surface volume ratio, these particles may have different properties. Sorry. The second element is that, yes, this guidance means that they may be new considerations for substances that have been already previously assessed by EFSA. And I will say that this is normal. In the several of the regulatory processes that are triggering EFSA assessments, there is always a need for reassessments, reevaluations. If there is new information, there is a need to reassess something that was assessed in the past and considered safe in the past, because the key element for us is to, and as already mentioned for you, is to be sure that we need to protect the consumers. Science evolve, so scientific knowledge means that we need to have a new guidance, specifically in the area of nanoscale considerations that were only partially covered in the previous EFSA assessment. So yes, you may have a previous dossier, but the previous dossier may not, in most of the cases, not include sufficient information for assess that fraction of particles. So in the new reassessment by EFSA, you will need to have new elements to be considered. It's applicable to all the chemical substances, and the materials need to generate sufficient specific information. And with the guidance that we presented yesterday, we try to clarify which information should be presented, and including the dossiers. And you have different options. I will say that one of the key elements, and I think it's one of the benefits of working in food safety, is that all of us are consumers as well. So you may need to consider that also for protecting our families, our friends, all of us, we need to be sure that it's important that we update frequently the scientific processes for assessing safety according to the current status of science. And as science evolve, you may need of the applicants, of the interested parties, may need to invest a little bit to demonstrate and to keep to be able to demonstrate that even with the new information, your materials and your products are safe. And one of the elements is that this new information may be relatively simple. So your material is soluble. The only issue is to demonstrate and demonstrate in a way that we give specific indications and in the guidance that is really soluble. It's not that you have a dispersion of small particles. And if when you do the test, you demonstrate, you find that in reality you have not a real solution, but a dispersion of small particles or a dispersion of nanoparticles, then it's logic that they will need to expect something from you. The same if if solubility or dissolution rate are not relevant, if for your material is clearly is not soluble, but you assume that you have no small particles, all the particles are large particles. Again, we need to request just to ensure that consumers are fully protected, that you have um, sufficient information to confirm that there are no nanoparticles in your material. And again, if you find nanoparticles, then you need to address those nanoparticles. But in both cases, so if at the end you see that in reality you have properties that you were not aware in your material, this can be also a good opportunity. In the area of nanotechnology, there are a lot of innovations also related to food and food safety. There are a lot of EU projects that are working and looking for cases for using nanotechnology for safe and sustainable design. So if at the end you find that your product is different from your initial assessment, obviously from the safety perspective, there is a need to address those properties, but also could be also a good opportunity. And finally, the guidance is based on flexibility, but also need consistency. There were some questions in the chat yesterday that I want to try to address here. The appraisal route, all the appraisal routes are equal. You should select the one that is more relevant for your chemical. It's sufficient that if you are able to demonstrate, according to the table 1 in the guidance, that one of the appraisal routes is fully met, that is sufficient. There is no need to go to the next. Which one? It depends on the material, so feel free to select the one that you feel is better, and if not, try to use another one. And second is the consistency. We are talking about properties at the nanoscale. So it is clear that your material have these properties, this large specific surface area. The risk assessment obviously need to include these properties. And that is very clear in the guidance. If you have a nanostructured material, so the size of the particles is not relevant because it's the structure of the particles that provide this large specific surface area, then it's clear that you need to go immediately to the scientific guidance, the guidance for the risk assessment for the nanomaterials that will be presented today. The same if you have nanocarriers or you have a nano design for facilitating the capacity of your material. In those cases, please do not waste time trying to apply the technical guidance. Move directly to the guidance for a risk assessment, because you need to do a risk assessment considering that, as you know, your material have these properties at the nanoscale. And this second guidance is the guidance that we are going to present today, are nanoscale considerations for the risk assessment. Obviously, the guidance is applicable to engineering nanomaterials, so those that met the definition in the Novel Food Regulation. Also, nanoforms, that are defined in the food content material regulation, but also in the area of pesticides, because pesticides are covered by the original regulation and their definition for nanoforms. So those are legally defined, and those are the definition. Those are the legal definition, not the threshold that we have in the guidance. But also, in case that applying the guidance on particle technical requirements, and you see that your material have a fraction of nanoparticle that require risk assessment at the nanoscale, you should use this guidance as well. And as already mentioned, also for nanostructured materials or nanocarriers. I will repeat for those that are new today, the practical arrangement. The meeting is recorded, and the recording will be made available in the EFSA web. The presentation will be also disseminated in the web, the PDF of all the presentation, but also the recording of the speech will be there. For all the participants, please use the chat function. The number that the participant register was too large to allow something else than the chat, so it will be impossible if not to handle the meeting. So use the chat function. Use also the like function in the chat, because that will allow us to select the questions that are much more relevant for us. Indicate your names from the organization, and also indicate the name of the speaker, or if it is general, just put nothing or put EFSA, that to which you address your question. And then from the questions, Google selects question. We have a few questions from yesterday that we thought were very relevant, and we will start with these questions, and then new questions from today. And we have two dedicated sessions for the questions and answers that will be covered. After the meeting, we will produce a document with the general questions that we feel are more relevant to all participants and specific answers. And again, we are not going to respond specific to question on specific materials. If you have you see that your question was not answered properly, or you have follow-up, please use the Ask EFSA system. And with that, and the indication of our one conference, I will stop sharing. And then we can start with the program for today, that obviously start with the presentation of the guidance for nanospecific risk assessment. And it's my pleasure to pass the floor to my colleague, Irene Cattaneo, that will present this guidance for you. Irene, please.
Thank you, Jose. I think it's arriving. Please let me know when you see it.
It's moving now.
Can you see it?
We can see it, yes.
Okay, perfect. Good morning, everyone. My name is Irene Cattaneo, and I will present today an overview of the second EFSA guidance on nano, which is the EFSA guidance on risk assessment. The full title is Guidance on Risk Assessment of Nanomaterials to be Applied in the Food and Feed Chain, Human and Animal Health. Upon a request of the European Food Safety Authority, the Scientific Committee has undertaken a review of the guidance on risk assessment of the application of nanoscience and nanotechnologies in the food and feed chain, Part 1, Human and Animal Health, that was published in 2018. The revision, the revised version of the guidance was then published last year in 2021, and the update version of the guidance maintains the original focus, which is providing an overview of the additional and complementary information requirement that should be provided when dealing with risk assessment of nanomaterials. Moreover, the update contains and provides all the updates currently available on scientific knowledge, and also present an improved usability, which was gained through the experience with actual cases from the pilot phase of the guidance. It are also included legal clarifications from DG Sanco on the applicability of the definitions under the novel food and REACH regulations, and the updated version of the guidance has also addressed all the comments and feedback received through the cooperation and inputs from European member states, as well as JRC, ECA, and DG Sante. Moreover, a review and an update was necessary because of the publication of the complementary EFSA guidance on particle technical requirements that was published after a mandate from the European Commission and was presented yesterday by my colleague. This slide presents which is the scope and when this guidance should be applied. A full assessment addressing the properties at the nanoscale is required if the applicant or the risk assessor concludes that the material meets the criteria of the definition of engineered nanomaterials of the Novel Food Regulation, is a substance to be used to manufacture food contact materials which is in nanoform, or deliberately engineered to particle size which exhibit functional, physical, and chemical properties that significantly differ from those at a larger scale. Is an active substance in plant products production consisting of or containing nanoforms according to the Provisional Commission regulations, or is a PPP with coformulants in nanoform, does not meet the above-mentioned legal definitions, but consists of or contain a fraction of small particles, so requiring assessment in the nanoscale, identified according to the guidance on particle TR, or is a nanostructured material or a material including materials formulated in the form of nanocarriers, which could retain properties that are characteristic of the nanoscale. For example, related to the large specific surface area of the materials or different toxicokinetic behavior as significant changes in absorption, distribution, and or metabolism as compared to the non-nanomaterial form. This guidance is aimed at all the interested parties, but in particular should be considered by applicants and risk assessors. This is a graphical representation on how to use this guidance in relation to the other sectoral EFSA guidances. What is important to say is that this guidance is complementary to the EFSA guidance documents on conventional materials. So applicants should use the EFSA relevant guidance for the uses to be covered by the application, but should also consider and take into account specific consideration in relation to the nanoscale when addressing dealing with the nanomaterial. So if the material falls under the scope of this guidance and is legally defined as engineered nanomaterial, nanoform, or have properties characteristic of the nanoscale, the guidance should be applied. Otherwise, the guidance on particle technical requirements could be useful to understand if the material contains a fraction of nanoparticles. If this is not the case, the guidance for conventional material is sufficient. Otherwise, the guidance should be applied. This is a general structure of the guidance, which is composed by 9 chapters and 4 appendices. We will see a little bit more in detail the main chapters of the guidance and the appendices. The first one is an introductory chapter with the background, terms of references, scope, and how to use the guidance. Chapter number 2 provides a description of data and methodology used. And chapter number 3 describes the general outline of risk assessment of nanomaterial, why is it necessary, and which are the critical points. Starting from chapter number 4, the tiered approach risk assessment starts that should be followed until chapter number 8 with risk characterization nanomaterials combining so the exposure assessment and the hazard identification, characterization, and the material, and chapter number 9 describes the uncertainty analysis. This is the schematic outline of the structure of the guidance, and you can see here the tiered approach. Each step should be followed step by step, and each chapter is related to a specific part of the guidance. There are many of the scheme or of the flow. There are four main steps that should be followed. The first one is identification of materials requiring nanospecific assessment and their physicochemical characterization. After this first step, the following is in vitro testing and in vivo testing and targeted in-depth test. In parallel, the oral exposure assessment, and then in the end, the risk characterization on the material and the uncertainty analysis. The guidance also present different exit points for which relevant scientific evidence is needed. In case an exit point can be applied, the conventional guidance is enough and should, for the application considered, is enough and should be followed. Let's start with chapter 4. So, which are the materials to be assessed under this guidance? As said before, if the material falls under the scope of this guidance, the guidance should be applied. Otherwise, the guidance on particle technical requirements should be applied. If the material then contains a fraction of nanoparticles, the scientific guidance should be applied in any case. The second step is the physicochemical characterization of the nanomaterial. Detailed characterization data must be provided for each nanomaterial in its pristine form, both identity and relevant physicochemical properties, including solubility and dissolution degradation rate, which are critical elements for the physicochemical characterization that can lead to understand if the nanospecific properties of the material are maintained or not. If yes, then the user can proceed with the following step of the guidance. If no, the guidance for conventional material is sufficient. Related to the chapter number 5, the Appendix B provides an overview of the currently available standard methods for the physicochemical characterization, and specific attention should be given to protocols regarding sampling, sample preparation, and dispersion protocols. In this slide, you can find a summary of the Table 1, which is included in the Chapter 5 of the guidance. Table 1 is divided in 3 subtables and provides a list of parameters and descriptors of data that should be assessed and taken into account. For example, table number A, in table number 1A are listed information to be provided on the overall material as general information like name, description, intended use, material composition, particle size, particle shape, and so on. Table 1B, information on the chemical components. This information should be provided and given for all the components of the material in case of multi-component particles. And Table 1C, extrinsic properties of the material as in the final product. And here we can find very important parameters as stability, pH, solubility, dissolution, degradation rate, dispersibility, and so on. Not all the parameters may be relevant for nanomaterial. It is important to justify if, in case one parameter is not relevant, why this has been excluded. Following with chapter number 6, oral exposure assessment of nanomaterials. So if the nanomaterial is directly added to the food or feed, so the exposure for human and animals is a direct exposure, the first step is to understand if the nanomaterial or its degradation products in nanoform fully dissolve or degrade in the food or feed matrix. If this is the case, the guidance for conventional material is sufficient. Otherwise, the following step is to understand if the nanomaterial, or again, its degradation products in nanoform, quickly and fully dissolve or degrade in the gastrointestinal tract. It is important to say that if it cannot be determined whether a nanomaterial is present in the food or feed matrix, it should be automatically assumed that the nanomaterial is present. There are also some specific considerations that should be taken into account for some products, some regulated products as food content materials, feed additives, and pesticides. Specifically for food content material, it is important to understand if there is transfer by migration or physical release and in the food or feed matrix, and if in case of feed additives and pesticides, if residues both in feed and additives and pesticides are present as particles. The Appendix C is linked to Chapter 6 and provides the rationale of the dissolution degradation rate to understand whether the material fully and quickly dissolve in the gastrointestinal tract, so if the conventional guidance is enough or the guidance risk assessment should be applied. In chapter number 7, are described hazard identification and hazard characterization of nanomaterial. This chapter is divided in 3 big steps and is composed by 10 subchapters. The main blocks describes in vitro testing, in vivo testing, and targeted in-depth testing. Subchapter 7.9 is about read across, the possibility of applying read across for risk assessment on materials, and chapter 7.10, integrated approaches to testing and assessment, so IHATs. We're going to see now a little bit more in detail these sub-steps. So starting with the stepwise approach, the first step is the need for investigate if the degradation rate which is the degradation rate of nanomaterial to the non-nanomaterial form under representative conditions of the gastrointestinal tract through the use of in vitro digestion models, which can represent fasted or fed state and worst case conditions. So if the material quickly and fully dissolve or degrade under the digestive tract conditions, the assessment can continue. The assessment, there's no need to continue. If no, the assessment can continue. And the following step, review, step 2A, review of existing information, consists of the collection of available information and definition of a set of in vitro studies to identify hazards and the eventually need for further testing. Continuing with the flowchart, the following step consists in the generation of new in vitro data. Specifically, this data should be referred to genotoxicity testing, dissolution under lysosomal condition, and cellular toxicity. A few words about the genotoxicity testing. It should follow the general indications of the EFSA genotoxicity testing strategy, considering that the AIMS test is not suitable for the assessment of nanomaterials and nanoparticles, while a mammalian cell gene mutation test should be preferred. It should always include an assessment of cellular uptake and a suitable battery of in vitro tests with critical endpoints as gene mutation, structural and numerical chromosome aberrations, and should be followed up with an in vivo study later at the stage of step 3B, in case at least one of the in vitro tests indicates genotoxicity activity. So if the material is persistent and there is indication of toxicity, the following step foresees the performing of in vivo testing. In vivo testing, in the context of this guidance, are nano-adapted in vivo testing. The first step is step 3A and consists of a pilot in vivo study for dose finding and assessment of ADME, so absorption, tissue distribution, accumulation, and extraction. This step should be then followed by a modified 90 days oral toxicity testing covering local effects in the gastrointestinal tract and organs that should be investigated by histopathology, specifically liver, spleen, brain, and gonads. And this is the step in which potential nanomaterials with potential for immunological, proliferative, neurotoxic, reproductive organ effects, toxic effects, or endocrine-mediated effects are identified. If there is a concern and there is a need for further testing, step number 4, so targeted in-depth tests with additional toxicokinetic studies, reproductive and developmental toxicity studies, and so on, should be performed. When dealing with nanomaterials and nanotechnologies, there are some critical elements that should be considered and kept in mind. First of all, OECD test guidelines and other testing protocols require specific adaptations when testing nanomaterials because, for example, of the potential for aggregation, disaggregation, agglomeration, deagglomeration, and stability issues in different media. Secondly, the Ames test, as said before, is not considered suitable for nanomaterials, and the mammalian cell gene mutation test should be used instead. Moreover, justification on the selected doses for the in vitro studies and concentrations for the in vivo studies should be provided, and studies conducted at high doses without further information on dispersion and stability or confirmation of cellular or tissue exposure are insufficient for the hazard assessment of nanomaterials. When possible, an additional experimental group exposed to the corresponding non-nanoform should be included in both in vitro and in vivo studies. The confirmation of exposure in target tissues for the in vivo or in target cells for the in vitro should be demonstrated and, if possible, also quantified with appropriate techniques. And also the reporting should be supplemented with detailed descriptions of the nanospecific issues. To conclude with the general structure of the guidance, here you can find a list of the appendices that are present at the end of the guidance. Appendix A, demonstration fact sheet for component 2. Appendix B, as explained before, characterization techniques, so provides a list of standard and currently available methods for the physical-chemical characterization. Appendix C, uncertainty analysis of high dissolution degradation rate, and the Appendix C provides additional information on some specific regulated products as feed additives, pesticides, food contact materials, nanofibers, nanocarriers, and fertilizers. The updated version of the guidance presents many have been inserted many schemes and graphical representations. For example, this graphical representation for food contact material, in which is very important to understand if there is actually a transfer of nanoparticles from the food contact material into food, if the nanoparticles are persistent, and so if the guidance should be applied if this is the case. I would like to conclude with a very short take-home message. First of all, OECD test guidelines require nano-adaptation when testing nanomaterials, nanostructured materials, and materials containing a fraction of particles at nanoscale. The second very important point is that nanospecific risk assessment should integrate the sectoral conventional risk assessment, so this guidance is complementary to the other EFSA guidance documents for conventional materials. And lastly, when a conventional material contains a fraction of nanoparticles, the risk assessment should consider the risk of both fractions, so the combined information should cover the safety assessment of the full material. Thank you very much for your attention.
Thank you very much, Irene, for your excellent presentation. Very clear. As Google do the same process like yesterday, so Google collect questions in the chat, and Google answer the questions later on. And now Google move to the complementary presentation with the specific examples, this time in the area of toxicology, to be provided by the experts in the working group. So let me share the slide.
Thank you.
And so this time will be David Gott, Alicia Mortensen, and Agnes Oman presenting the specific elements and examples in the area of toxicology. And the first is for David. David, the floor is yours.
Thank you, Jose. I realized to people looking at the guidance, it looks scary. It looks daunting, the amount. But really, the golden thread is this is no more than building this muscle and the structure on the principles that were expressed in the very first guidance. So if we talk about examples, if we evaluate a new form of an assessed substance, the substances have a long history of use in other formulations and various routes of exposure. However, the question asked of EFSA was on a new form which met the definition of a nanomaterial. This form had been characterized, and there is limited information on existing forms. So what were the key questions the risk assessor and indeed the applicant were trying to answer? Was enough known about the historical uses to say these were comparable to these material and allowed you to use these data? Where the data came from use in another route of exposure, was there anything that said we could use this route to be relevant for the oral route? And finally, what information was there on the older materials? And this provides a particular challenge we realize to applicants, because if you're using old data, this stuff may not have been done. Indeed, it may not technically have been possible when it was done. So you're looking for, can you find information there or now that shows that it was similar? Next slide, please, Jose. So in this particular example, we knew lots about the consequences of historical exposures. This material in various forms had been around for 100 years or so. We knew lots that had different routes of exposure. It behaved differently when it was used on the skin or in oral exposure. But more importantly, we knew something about the mechanism of its effects. This material, we knew how it worked. We had some mechanistic insight. Clearly, what we didn't know was we didn't know the detailed characteristics of the old formulations. But critically, we knew they were different to the new one. Critically, we knew it behaved differently when given orally. And the crucial part on the last saying, well, we can't really rely on this, was because there was no data, no evidence to demonstrate that the new formulation went to a key stage of the mechanism. Therefore, we were coming to the conclusion we could not use the existing data and the existing material to extrapolate to this new one, and new testing would be required. Thank you, Jose. Now I think it's next slide and Alicia.
Thank you, David. Yes, Alicia, please.
Just a moment, maybe camera, so you can see me. Thank you very much. So I am going to indicate for you how relevant it is, the data on the material which has been used in the toxicological studies. So
sorry,
if
Alicia, your
talk...
camera is not on. Could you please put on your camera?
Oh, it should be. Turn camera on. Can you see me now?
Yes, now we can see you.
Okay, thank you very much. And sorry, I could see myself, but sorry you couldn't see me. So I am going to indicate relevance of the test material used in the studies. And we can be in the situation, as David said, that we have old studies and the material which has been evaluated in the past is already marketed. And then what we know about the test material. So of course, this test material has to be within the specifications. And this is both for new materials and for the old materials. For new materials, the applicant, as you know, proposes the specifications. For old materials, which are authorized already and are on the market, there are specifications. And the test material should also comply with those. And then also, when we are talking about the conventional material, bulk materials, which contain a fraction of small particles or nanoparticles. So the tested material, when we look at it, has to cover the worst case conditions for containing this fraction of small particles, but also the worst case condition which mimics the consumer exposure. Yes. And then we have, for the old studies, 3 possible options. For new also, we have the same, but it is easier because you generate new data. So we need to have full physical chemical comparison of the material which is marketed in case of old and proposed to be marketed for new applications. And this concerns, for example, shape, crystallinity, size, purity. If relevant, maybe there are some surface modifications of the material. And of course, the size distribution is very important, and the purity of the test material. But all factors which are indicated in the technical guidelines and in the scientific guidelines have to be provided, have to be known for us. And another possibility it is that we can base comparison if the old material used in the studies can provide information for the material which is on the market. It is the test material. We compare its production process, and always for new or for old, the test material should be produced in the same manner. And also, if we investigate batch-to-batch variability, this should be representing that the variability is limited, and if there are specifications, so according to the existing specifications or according to the proposed specification for the new material. And another possibility it is that we can try to apply read across, which is an old method and has been applied in the past also in EFSA evaluations. It can give some challenges still according to the present state of knowledge with the nanomaterials, but it is always worth to see if the read across is possible and which kind of information we could get there. So you see, it is weighing all the time the data on marketed material and tested material. And I would say that the technical guidelines has a section especially dedicated to how the information from existing already studies for conventional material which were not designed to address the fraction of small particles can be used. So what has to be considered? Please, next slide. Yes, and then important for the animal testing, in vivo testing, it is a selection of method of administration. David said already that we could have information from other routes of exposure. For materials in food, of course, oral route is the most important and most appropriate. And we have 3 options. As you know, nothing new in this. It is gavage, mixing in feed, or giving it as a beverage, so mixing to drinking water. And we always have to consider which route is the most representative for the consumer exposure, for the worst case of actual use. So if the compound is used in solid food, you have two possibilities. You have mixing with feed, which is the first choice, and then gavage. If it would be a case of a nanomaterial, then of course we have to consider agglomeration. And therefore, sometimes it is necessary to use gavage. Gavage has also been used in several studies with the conventional material, but you have always remember how to put arguments that this is the most appropriate route of exposure. And in 90-day study for nanomaterials by gavage, we advise that you consider that you can have a satellite group which is exposed, which represents this worst case of actual consumer exposure in feed, for example, if it is used in solid feeds, solid food products. Yes, so you see we have always weight because we give guidance, the choice is yours. But we have, as risk assessors, the same considerations and as you when preparing the dossier. Thank you very much. Next slide. And I think it will be my colleague Jose. Thank you.
Thank you, Alicia. Yes, I will take this slide. It's connected to the possibility for using non-animal testing. This is already well done in the area of genotoxicity. As you know, we always start with in vitro studies. One of the key elements is that the absorption of the nanomaterials is absolutely critical. So for assessing the different mechanistic mode of action of genotoxicity for mutation, the AIM test, as Irene was mentioning, is not suitable. So we need to have a mammalian gene mutation test and should be included as part of the integrated approach for testing and assessment. One of the key elements is to get information on the actual material that has been tested, like information on physicochemical properties, nanoscale, but I will address again what is absolutely essential is to measure cell internalization. This is very clear in the guidance for genotoxicity for in vitro, but the guidance also suggests to extend this to all in vitro methods that will facilitate the use of in vitro and new approach methodologies. And one of the elements that I will reinforce again is the need of consistency. There are several methods that are offered through OECD. Each method are offer the use of different thread lines and also different conditions. But obviously, one of the key elements is not only to measure, but also that you find the internalization of the particles. So is the first method that you observe in the system is not demonstrate that for that particular cell and that particular conditions, there are the particles have not been obtaken by the cells. Obviously, the results are useless unless you can clarify that you do not expect any uptake of the particles based on the toxicokinetic assessment. But if you have say, a material that you already observed that there is some uptake, then you need to confirm in the genotoxicity assessment that the nanoparticles have been uptaken by the cells, because that is the only way that we can address this essential endpoint. And with that, I will move to Agnes for the next question. Agnes, please.
Thank you, Jose. So Jose pointed out some experiences from practical application of the guidance for in vitro studies. And here are a few slides on the relevance of existing in vivo studies. So first of all, as also Alicia pointed out, it's very important to have information on the physicochemical properties of the material used. It is pretty a no-brainer, because you just want to know what kind of material has been used in your existing in vivo study. And if this information is not available, the study can be seen as not relevant for the risk assessment or considered of low relevance. And we are talking here about information like the size distribution and the purity, but also a number of other physicochemical properties that are indicated. Please, next slide. In addition to that, it's important to have a proper dispersion and stability of the dispersion. So also here, studies with no or limited information on this dispersion are considered of low relevance. And this relates to the manner and the matrix of administration, like whether it's in gavage, in food, in drinking water, and it should be representative for human exposure, but also covering all kinds of exposure scenarios. And this can be considered or shown by using dispersion protocols. And it should be kept in mind that at high dose levels, it is likely that the degree of agglomeration will increase. And if there is information on measurement of the concentration and also on the dispersion in the administration matrix, this will help to assess the relevance of this in vivo study for consideration in the risk assessment, for example, by information by DLS or EM images. Next slide, please. So how is this applied? As an example here for assessing the dispersion and the considerations for interpretation. For example, different scoring can be applied. So in this case, score 1, where there is verifiable evidence on the degree of agglomeration and or confirmation on the internal exposure, then the results are relevant and reliable for assessing also the small particles, including the nanoparticles of this study. A slightly lower score could be given to studies that are incomplete, but there's still evidence on dispersion considerations or on confirmation, or if there is some confirmation on internal exposure, and then the relevance of the results for assessing small particles, including nanoparticles, may be affected by the agglomeration, but there is still relevance there. In this case, for score 3, there's a lack of protocol or information and but still low doses are tested. So it may be possible that there is a high degree of, well, the dispersion was still okay. And then the relevance of the results for assessing small particles, including nanoparticles, may be relevant, but cannot be verified. And then as the last score, lack of protocol or information and only high doses tested. And then the results may be informative for larger particles and large agglomerates, but not for the fraction of small particles, including the nanoparticles. Next slide, please. So how can this be verified? The adequate level of dispersion, there is also information on this in the technical guidance that was presented yesterday. So for example, dispersion by using the SOPs from nanogenotox or EMPRA or nanogreg, or so there are some protocols there to be used. Information on the energy used for the sonication, or there's confirmation that there is sufficient level of dispersion based on the stability of the dispersion, for example, with the zeta potential, or by providing information via electron microscopy or DLS. The use of effective dispersion agents, or if there is a good level of agglomeration in the stock suspension that is used to mix with the feed that the animals are provided with, or there's confirmation of the cell or tissue exposure during the test. So this is more related to the internal exposure. Has the material really be taken up by the animal or by an in vitro cell system? Next slide, please. And then if the guidance on nanomaterials applies and you really should take into account the nano considerations, then there is also need for some toxicokinetic information, like information on the level of absorption and the potential for accumulation. But of course, we know that in many toxicity studies, there's not so much information about the internal exposure. But if you have this information, then it is very useful in the context here. And if you look at what kind of information can be present in existing toxicity studies, it could be either qualitative information or quantitative information. And it's also important to have a look at the reliability of the analytical method. So when you have this information on internal exposure and you assessed whether it's qualitative or quantitative and the reliability of the analytical method, then you can use this information, for example, to verify if there has been actually absorption from the gastrointestinal tract. It can provide insight in the relationship between the dose level that is used and the internal exposure. It can provide insight in the potential for accumulation, which is something we would like to consider in the case of nanomaterials and small particles. But you need several time points there, and it also allows for a better comparison between different studies. Next slide, please. Important to take into account in this case is the control group and see also if there has been exposure in the control group that could, for example, be related to background exposure. So is there some other kinds of exposure, for example, to particles of the same elemental composition, but also especially if the analysis is performed on the element rather than the particle, if there has been other background exposure, and this has to be taken into account to see if the control group is indeed lower as compared to the dosed groups. And then as a last item, the duration of the study or of the exposure. Nanomaterials may accumulate in time. And if you have some information on the internal exposure, this can be, you can get this insight if this accumulation is likely to occur, but also if steady state has been reached and if the study duration that is used is adequate. And I think with that, I reach my last slide and it's back to Alicia.
Thank you, Agnes. Alicia, please.
Thank you very much. Can you see me?
Yes.
Yes, thank you very much. Yeah, Agnes touched very important points about the internal exposure. And in many old toxicological studies, when I started as a young toxicologist, and please, it is in 80s, yeah? So it was not always done that we, for example, showed absorption in the toxicological toxicity study, because we had some other ADME studies on metabolism and absorption, and we knew that the compound is absorbed. And then this absorption leads to internal exposure of the organs. However, it is very important nowadays when we perform toxicological studies, the classical toxicity studies, according to OECD guidelines also, that we have information that the animals were really exposed, that the compound was absorbed, not only from the necessary ADME studies, but also from the current systemic toxicity study. So here I am going to talk about that we need to assess local effects in gastrointestinal system. As you know, 28-day study and 90-day study, OECD test guidelines indicate that among the organs and tissues to be studied histologically under microscope, there has to be a sample from intestine and also with the Peyer patches which are present in gastrointestinal tract. So, for materials which consist of small particles, nanoparticles, as you may remember, they have a tendency to agglomerate rather than disperse, and this we expect is happening in gastrointestinal system. And this agglomeration, you can see some examples of photos that particles are coming closer and closer from the published papers from my institute, and I am co-author of these works. So they will cause, this agglomeration may cause high local concentration of the compound. And when we have this contact with the gastrointestinal wall, which is in fact the first surface of cells, enterocytes, and then modified enterocytes, so-called M cells on Peyer's patches, so there can be contact, and the contact can be because the material releases dissolved chemicals from the solid matrix or from the vehicle given by gavage or from the drinking water, depending on the route of administration. And there can be another mechanism. This is the presence of particles which are touching the wall of gastrointestinal tract and can cause some mechanical damages. So this can lead to several changes. One, when it is repeated exposure and maybe the damage is not really at high concentration cost, so it would be a chronic inflammation. And we can study this. Please look, here there is a rat, and we take gastrointestinal system, which is long, you know, from the rat. We cut it in parts of small intestine, cecum, and large intestine. And we prepare Swiss rolls on a pin, and then these Swiss rolls can be processed. And then we can look under microscope. And the example is from the study in which I also contributed. It is, you can see the wall of intestine. Sorry, I do not have the indicator. And there are villi on the surface of the intestine into the lumen to intestine. And you can see some black material. And this is, we used autometallographic staining on ileum parts to demonstrate silver particles. As you can see, they are entering the villi, inside the villi, so just after the enterocytes, inside the villi, and further or deeper in the wall. Next slide, please. Okay, couldn't you hear me?
Yes.
Okay, the next slide is coming. Thank you very much, and yes, sorry for this disruption. So we continue in assessing the local effects of GIT, which are very important for small particle, nanoparticle materials. Local effects are relevant because we have external contact with the cell membrane with enterocytes and modified enterocytes on Peyer's patches, but also the material is coming into the wall, and maybe it is trapped if there is no absorption. So this can cause, you know, some changes which lead chronic inflammation, as you know, can be connected in some research to the obesity, for example. But there could be also necrotic changes or proliferative changes. So local effects in the gastrointestinal tract are key element for assessing safety in case of no absorption. And this is an example when you can see a histological slide, traditional hematoxylin eosin staining, and you can see villi like a cam coming there, and the blue parts with some cells, of course, these are Peyer's patches seen in this staining. And using Cytoviva enhanced dark field hyperspectral system, we can visualize particles, which are in this case from cerium oxide oral exposure of the rats, you see the white spots. I hope that they are visible on your microscopes. We indicate them in the villus and in a Peyer patch. Thank you very much.
Thank you very much, Alicia. And with that, we will finalize the presentation. One of the elements that obviously has been discussed, and we see a lot of issues in the chat, is connected to the try to avoid the use of more animal testing. That is obvious for everybody. There are ethical issues, but also scientific issues there. And also the lack of OECD methods, particularly in the area of in vitro, that are currently able to progress into final test guidelines. The process for having an OECD test guideline is very long in the area of new approach methodologies. We feel that from EFSA that there is a need to have something else to offer the possibility for using methods that has been validated scientifically. And we already started a project, and now we will have very soon publish our roadmap for NAMs that includes the assessment of and the use of this kind of methods. And it's my pleasure to pass the floor to Francesco, that will present one of the projects that we are funding from EFSA. This is a very specific one, but I'm happy to have Francesco presenting this to demonstrate that there is also the possibility for use NAN method to clarify issues at the nanoscale. So Francesco, please, the floor is yours.
Thank you very much, Jose. I'm trying to share my screen. Sì.
Well, Francesco and the colleagues are solving this technical problem. I want also already to alert you that we are planning to launch a large grant, obviously with the full cooperation with member states, to demonstrate the possibility of using NAM methods in this area. So we have already scheduled a meeting with the member state organizations and researchers in the area for April, and then before the summer, we are planning to launch a big project that will allow us to move into that direction and to try to solve all the problems that we have at nanoscale using non-animal methods. I think that that has been one of the priorities that has been identified for the data integration in the area of the EFSA roadmap for NAMs, and I think that we can do that. Now, Francesca, we can see your slide. That's perfect, but we cannot see you. If you can put, now we can see you. So
thank you very much.
Everything is ready.
Problems,
Thank you. No problem. The floor is yours, Francesco.
Thank you. So I'm very glad to briefly present this EFSA-funded project on the use of new approach methodologies for the hazard assessment of nanocellulose oral exposure. You may know that nanocellulose is an emerging material in the food sector with several prospective uses, including food packaging, some technological uses, but also a potential new ingredient, so a new novel food. There are different sources of nanocellulose, and actually nanocellulose may come in 3 different forms depending on the source. These may be a bacterial nanocellulose or nanofibrillated cellulose or cellulose nanocrystals. So these biological sources and the preparation conditions to lead into the final material have been shown to affect several physicochemical parameters of the nanocellulose materials. So they are important to be considered, and this diversity has to be covered. So the potential hazards of ingested nanocellulose are presently insufficiently characterized, and the nanoscale features of nanocellulose require a nanospecific assessment according to the guidance, to the nano guidance, and especially we felt it was necessary to focus on potential local adverse effects in the gut, on a potential crossing of the intestinal barrier, but also to tackle the issue of possible degradation of nanocellulose by the human microbiome, because these might deliver potentially smaller fibers in the colon. It is interesting to note that in this specific case, laboratory animals are not appropriate models, because the digestive physiology, but also the microbiome and the rate of fiber degradation differs from humans. This is a specific case where NAM-based approaches are extremely relevant, especially to gain a mechanistic knowledge about the possible adverse effects. So the project aims to design and conduct a set of name-based studies for addressing the current data gaps on nanocellulose hazards, but also offer a proposal for including the results in the regulatory hazard assessment of nanocellulose for consumers exposed via food. So we set up a battery of in vitro tests, providing insight into nanocellulose hazard and mode of action, and also with the aim to assess potential relationship between toxicity and physicochemical characteristics, because, as I said, we aim to cover diverse materials with different physicochemical properties. And the monoculture system will be used, and a number of relevant endpoints will be addressed. The consortium is composed by 4 European research institutions, plus the European Commission Joint Research Center, which joined the project as with an in-kind participation, so it is not covered by the EFSA grant, but overall these 5 partners provide a thorough coverage of different aspects related to physicochemical characterization, toxicology, and the specific study on human microbiome. A tiered approach was designed for testing the nanocellulose test materials. So in tier 1, a number of different materials belonging to the 3 main classes I showed will be tested, and up to 3 of them will be selected to be investigated in depth in tier 2, and a single material will be submitted to specialized studies in tier 3. We aim to select a panel of nanocellular materials, up to 3 for each of the 3 main nanocellulose types, and all of them will be submitted to the initial physicochemical characterization and the 5th tier of in vitro testing. And we are still a bit struggling to find enough samples of bacterial nanocellulose, and I take this opportunity also to highlight these, and if there are any potential interested party in the audience which would aim to provide a bacterial nanocellulose sample, we will be more than glad to get in contact after the event. These different types of the 3 nanocellulose will be investigated, and specifically in tier 1, we design handling protocols in order to prepare nanocellulose suspension in the most dispersed state, so to ensure maximal deagglomeration, and also a thorough physicochemical characterization covering all the relevant parameters. But in tier 1, we will also use high content analysis to have as a preliminary screening tool to generate maximum amount of information on cytotoxicity using intestinal and macrophage cell models. Based on tier 1, up to 3 materials will be selected. For tier 2, tier 2 will entail a number of different studies. One first set of studies is the one addressing the issue of potential digestion or degradation of nanocellulose by the human microbiome. For this, ARCOL, which is a validated dynamic in vitro model of the human colon, will be used to follow potential nanocellulose degradation in human colonic conditions. It will be assessed if nanocellulose exposure has an effect on microbiota composition, but more importantly, the ultimate goal is to investigate the extent of digestion or degradation of nanocellulose fibers, and this will be done by examination via TEM. Another aim of tier 2 investigation is to investigate uptake and barrier crossing. This will be done with cell monocultures, where uptake will be studied using fluorescently labeled materials. And uptake and barrier crossing will be also studied using a tree culture model, including CACO2 cells, HT29 intestinal cells, and Raji-B cells. And this will be cultured on inserts, and also barrier crossing will be established. Tier 2 will also entail a series of toxicity testing studies. Toxicity will be tested in the culture model shown, but also genotoxicity will be investigated using both the COMET assay in different versions and also the micronucleus assay. Another objective of tier 2 is to investigate potential effects on mucus production and secretion. Mucus may play a role in the response of the intestine exposed to nanocellulose, so the impact of nanocellulose on both production and secretion of mucins will be investigated. Finally, toxicity of microbiome digested nanocellulose will be also addressed. So the idea here is to see if after potential degradation to possibly smaller fibers by microbiome mediated digestion, these fibers may have different physicochemical properties and potentially toxicological properties. And this will be investigated both in mono and co-culture models. Finally, one single material based on tier 2 results will be selected for toxicity testing in a culture model using repeated exposure, so addressing the issue of a more meaningful exposure scenario related to a possible consumer exposure over several days. The experimental studies will be performed so as to ensure that the results are relevant and reliable in the perspective of regulatory risk assessment, and the evidence gained in the project will be used to fulfill key data gaps in risk assessment of nanocellulose and possible uses, for instance, as novel food or food additives, as most likely application leading to direct exposure of consumers will be thoroughly considered in the perspective of translating the results of the project into regulatory hazard assessment strategies. So to conclude, I hope I was able to show that the increasing use of nanocellulose in food application requires an assessment according to the guidance for risk assessment of nanomaterials, and that a battery of in vitro tests provide insight into nanocellulose uptake and crossing, hazard, and mode of action is being used. And within this, a tree culture model is being applied for the first time to complex nanomaterials of organic nature. And with this, I thank you all for your kind attention, and I would like once again to acknowledge the EFSA grant, which is supporting this project. Thank you very much.
Thank you very much, Francesco, for presenting this very interesting project. I think that for EFSA is critical that we move into this area. We will use the same approach, so please, for the participants, if you have questions, put the questions in the chat, and we will address the questions to Francesco during the question and answer part of the this event. Yes, before the coffee break, I want to stress this, the last part of the presentation from Francesco. All the information, all the results will be publicly available. And one of the key elements for this project and several projects that we are conducted in other materials and chemicals as case studies have the key element to be able to provide guidance on how to use data from studies that are not yet approved as OECD guidelines. So a good scientific design supported by the use of the study as a weight of evidence for an integrated assessment and testing strategy, that will be more than sufficient. And I'm very glad that we will have in the second part of this morning also presentation that you will see that that is real, that some applicants have already started to use new approach methodologies and to include in vitro data for the mechanistic understanding, and that this has facilitated the evaluation of the safety by EFSA without the use of animals or reducing significantly the use of animals. So thank you very much, Francesco. Thanks to the members of the working group and also to Irene for the presentation this morning. We will use the same approach than yesterday, so we will break for half an hour in order to prepare the specific questions. And if you have a specific element, a question for Francesco, please put this in the chat and we will address this first, and then the members of the working group will address all the other questions in order like yesterday. So half an hour is 10:25, so we will break for 30 minutes. So we will be back at 5 to 11, so 10:55. Thank you. Okay, so it's time for starting the second part of the morning with the. I hope that you have time for enjoying coffee, tea, or whatever. I can promise that this has not been the case here. The colleagues very busy trying to put all your comments, all your questions in a way that we can address this during this session. But that is why that is our main role here. Try to follow your questions, identify the more relevant ones, and to present. So we are ready to start with a specific question for Francesco. So Francesco, I think that following your presentation, we have some questions in the chat. If you can answer, please put on your camera if you don't mind.
Yes, thank you, Jose. First question is about the possible presence of a fraction of nanocellulose in traditional cellulose materials. You may know that some microcrystalline celluloses, for instance, are used, I think, as food additives. So there are some indications in the literature that especially micro crystalline celluloses and similar materials which are already subjected to size reduction may contain a fraction of nanocellulose. So this is something that has emerged very recently in the literature. So in theory, these materials might be eligible for an investigation about the possible presence of a small fraction. And for the second question about the alcohol model, this alcohol model has been designed by the MEDIS group, which is based at University Clermont, Auvergne, or in Rai in France. And there is extensive literature documenting the design and the validation of this model, which has been set up in order to be representative and more physiologically relevant compared to other models when the human microbiome and the colonic conditions are to be simulated. And this group has also extensive experience in general with simulated in vitro gastrointestinal digestion. So I will be happy to share with who posed the question any information about this group and how to get in contact with them. Thank you.
Thank you very much, Francesco. And I will reiterate that the issue of validation is very complex in the area of new approach methodologies. So what we want is to have a kind of qualification fit for purpose, so that the results are sufficiently well described to have to be able to be verified by risk assessors during the safety assessment process. And also we are discussing with the US FDA to develop jointly a system for qualification of NAMP studies in this area. That will be part of the project that we will launch before the summer. With that, we will move to other questions focused on the EFSA guidance. So the next question is on nanocoatings, and I will ask Kasim to respond to this question, if you don't mind, Kasim, please.
Thanks very much, Jose. I think the question of nano coatings, nano layers, or whatever modification has been done on a nanoparticle surface comes again and again. And the sometimes argument is that nano coatings are in such small quantity compared to the weight of nanomaterial that it does not matter. But the main thing to remember here is that anything that is part of a nanostructure should be not only safe in itself, every component. For example, if a nanoparticle is composed of component A, B, C, and D, all components in their own right need to be safe. And more importantly, that the whole nano entity, when all the components are put together, that needs to be safe as well. So yes, the answer is that nano coatings, nano layers, or whatever is applied onto the surface of nanoparticles need to be shown to be safe themselves, but more importantly, they need to be shown to be when they are part of the nano entity as a whole. Thank you.
Thank you very much, Kasim. So we can move to the next question. It's related to the dispersion and the properties of dispersed samples. And I will ask the floor first to Agnes and then Francesco to respond. Agnes, please.
Yeah, thank you. Oh, just a moment. Yeah, so the question is, could you clarify the reasoning behind the requiring proper dispersed samples? So does it always need to be dispersed as a worst case scenario? You should note that dispersions and agglomeration and de-agglomeration is a very dynamic process. And in that sense, we ultimately want to cover all the relevant and realistic exposure conditions. So, for example, if you have large agglomerates in a sample in your in vitro experiment and they settle, then you don't have a kind of outcome, a toxicity outcome that is representative for the realistic situations, let alone to to cover the more worst case, realistic and relevant conditions. And the same also holds for in vivo. So if there are large agglomerates in the gastrointestinal tract, it may hamper the uptake of the material. So we really want to cover all the relevant and realistic exposure conditions, and in that sense, try to have the toxicity studies as much as possible directed towards the worst case for the realistic and relevant. And Francesco, could you complement this answer?
Yes, thank you very much, Agnes. I think the main elements are already given by you, but just to also highlight that nanomaterials are used to display properties enabled by the fact they are in the nanoscale. These also apply to a large extent to conventional materials that contain small particles, as they are normally subjected to processing conditions exactly to obtain specific properties associated to the small particle size. So thus normally they are well dispersed and heavily distributed throughout the product in which they are incorporated in order to maximize the properties for which they are applied. So as a rule, the technological procedures in use during production are designed to prevent that nanomaterial is extensively agglomerated, and because large agglomerates or aggregates would fail to display nano-enabled properties. Another element is that the presence of the food matrix and the occurrence in the food matrix of proteins and other biomolecules that absorb on particle surfaces avoid particle interactions leading to formation of secondary particles. And this is difficult to be simulated in testing. It is not the actual food that is tested. Therefore, ensuring proper dispersion is needed in toxicological testing. And for the measurement of particle size distribution, it is equally essential to ensure a proper dispersion, since results will be biased if particles are largely agglomerated, and it is the number-based particle size distribution of the constituent particles that has to be characterized. Thank you.
Thank you very much, Francesco. So we will move to the next question that is related to the screening assessment, and I will ask Hubert to respond. Hubert, please.
Yes, thank you. Yeah, the question is if you have a material that consists only of aggregates larger than 500 nanometer, but the constituent particles are small in the nanoscale, for example, 20 nanometers, whether such a material could pass the screening appraisal route. The answer is that such a material is a nanostructured material, and therefore it falls directly within the scope of the guidance on risk assessment that we are discussing today. So when you look, so the user should first check whether the material in question directly falls within the scope of the guidance and risk assessment. And here in the section 1.3, the last point, E, it is a nanostructured material, and therefore there is no need to apply the technical recommendations as discussed yesterday, because the material would directly fall within the scope of the guidance and risk assessment. So should be kept in mind that first the user should check whether the material falls within the scope of the guidance and risk assessment, and also to keep in mind that yesterday the discussion of yesterday's document is applying, so is helping to get clarity whether the material contains small particles. So it helps to clarify whether it falls under the scope of the risk assessment guidance, point D. But in that case, it would directly fall within the guidance on the risk assessment. And actually such a conclusion as made here would be a serious error. And the application, I think, would not be accepted by the EFSA as such. Thank you.
Thank you very much, Bert. So we can move to the next question. So we are moving to the area of toxicology. So I will ask Alicia and David to respond. So Alicia first and David will complement. Alicia, please.
Yes, thank you very much. I will try to put my camera on. So what is important to know? That, for example, EFSA evaluates of several materials which are either authorized as food additives or there is a feed additive evaluation. And yes, in this case, some of the studies were performed long ago. We cannot use these studies if we do not know if the material tested is the same material as it is on the market. I presented a slide and also my colleague Agnes was explaining why. These kind of studies, if you have possibility to demonstrate that the material tested in the past has been produced in the same way as the material which is on the market, this is one possibility, and that its physicochemical characterization are in resemblance of the material which is now on the market, this would be considered. All this is very well described in section 4 of the technical guidelines, how we can use the old studies, if we can use the old studies, what information we need. And I would say, if we cannot assess that the tested material complies with the material on the market, we have to consider whether the studies can provide additional information for the weight of evidence. This is, in fact, the situation of today. David, would you like to complement my answer?
Thank you, Alicia. I think it's true that we have the possibility of using old data, but we have to demonstrate that it's relevant. And I see from the comment from Scotty in the chat, yes, we accept it may not always be possible or difficult with old materials, but some of this comes about trying to give the level of reassurance that risk managers and the wider public need. In terms to the second point down here about the tests, the rejection of Ames test. Ames is an in vitro test. We're not suggesting replacing it with an in vivo test. We're suggesting that it's not relevant. It will tell you nothing of use on a nanomaterial. So you should use a second in vitro test to demonstrate that point. And yes, some of these tiered approaches will lead to a general overall lessening of the number of animals used. However, if there are scientific questions to be answered that need answering to demonstrate safety to a sufficient level, they may lead to using more animals, but that's on a specific case, a specific compound, and not overall. Thank you.
Yes,
Thank you very much, David. Yes, please, Alicia.
I would like to supplement because, you know, the question was that, yes, maybe we address that new animal studies has to be performed. However, it is not like this. In the EFSA guidance on genotoxicity, and the general one, the umbrella one, 2 tests in vitro are recommended to be used. The situation is, as David mentioned, different for nanomaterials because the bacterial cells might not be exposed, will not be exposed because they cannot absorb the nanomaterial in their cells. The material cannot enter the cell. We give also in the scientific guidelines, the guidelines on risk assessment of nanomaterial, proposal that after the test, which is the OECD test guideline 487, micronucleus in vitro on mammalian cells, you know, you can supplement it with a test for which we do not have yet the OECD test guideline, but it is known and validated by several laboratory tests, and this is in vitro COMET assay, also on, so in vitro test. this could be as a supplemental test, but if the test material cannot be dispersed in the medium for cell cultures in which we can perform the test, intend to perform the test, then we have to go to the in vivo studies. And this is the case. It would not be only the case for nanomaterials, but if it was a case with another material which is not nano, such a situation will also lead that in vivo tests have to be performed. Thank you.
Thank you very much, Alicia, for the clarification, and David. So we will move to the next question that in this case is connected to the electron microscopy. So I will pass this to Jan with this orders person.
Well, how to proceed if the material to be investigated is a biological substance? This makes screening by EM impractical and unreliable. I can imagine if you use material science technique to a biological substance, you can have impractical and unreliable results. I'm doing 25 years of electron microscopy and most of my samples were of biological origin. It's a matter of using the correct methods. I can maybe refer to the images that Francesco showed us of the nanocellulose fibers. There, to have enough contrast, we applied an uranula state-based negative staining to visualize them better. So on a case-by-case basis, you have to make sure that your methods are suitable to analyze biological samples. Thank you.
Thank you very much, Jan. So we are moving to the next question. Again, in the area of conventional materials and nanomaterials, and I will pass the floor to David.
Thank you. You have to, I don't wish to come across as perhaps patronizing, but I think we need to remember what we're trying to do in any risk assessment. We're talking about hazards, which are the potential harm from a compound, whether nano or not, and risk refers to the likelihood of that hazard occurring. There are a number of hazards arising from size, which may or may not be relevant. For example, if you took a 1 ton piece of iron and had it hanging above you from a thin piece of rope, there'd be a pretty big significant hazard of crushing and a significant risk. But if that was on the floor, solid, safe floor, there wouldn't be that risk. So the challenge from small nanoparticles is that at a certain point, their behavior will differ in biological systems, which is why the guidance tries to introduce a way of thinking into your assessment to determine what the hazards are and how likely they are. And that is irrespective of the legislative definition, which takes account of things like practicality, feasibility, and is aimed to define the boundaries and characteristics. And we recognise this provides challenges to applicants and assessors that will hopefully be reduced as we gain experience. I think one of the biggest challenges is that you have your clients, your colleagues who want simple tests, a simple answer. And this requires this approach doesn't provide a simple tick answer, but it provides a more scientifically sound answer that will be better in the longer term. Thank you, Jose.
Thank you very much, David. So we will move to the next question based on mixed and multi-constituents, and I will pass the floor to Stefan. Stefan, please.
Yes, thanks. This question is explicitly addressed in the guidance on the technical requirements, and it's said there that information has to be submitted both on the single constituent as well as the components in the mixtures individually, as well as then for the full material. There are given some exemptions for example, for botanicals and other complex materials of biological origin with unknown or variable composition, or macromolecules of biological origins. There, it would be possible for the applicant to provide a rationale demonstrating that an assessment of the fraction of small particles would not be needed or is already covered by the regular safety assessment process. So the answer is yes. In the mixtures, you have to look for the individual components.
Thank you very much, Stefan. And we were discussing yesterday also the issue of the alignment with other agencies in Europe and also internationally. And I want to stress here that we are using in both guidance the definition for substance, for mixture, and for multi-constituent substance that are exactly the same definition that ECHA is using according to the regulation. Part of the alignment between EFSA and ECHA was to be sure that we are using exactly the same definitions here and in Helsinki. Thank you, Stefan. So we will move to the next question that is on the, again, 16 safety studies, and I will pass the floor to Agnes. Agnes, please.
Yeah, thank you. So this was indeed already addressed upon just before, but it is an important question, so I'll just try to answer it. So if we know from the continued essentially unchanged production process that an old material used in an animal study has the same characteristics as the material marketed, can they still be used? Can this toxicity study still be used and avoid, in that sense, also unnecessary repeated animal testing? So the answer is, of course, well, this is up to a specific panel or working group that is doing the risk assessment, but in general, yes, it can be used in a weight of evidence approach. And the more is known about the material that is used in this old toxicity study, the more evidence you have and the more reliable the study is. So if you, for example, have some old material that can be retested, stocked somewhere, then that adds to the entire weight of evidence to see that the old material is the same as the material that is also used currently in the food or feed. Thank you.
Thank you very much, Agnes. So we can move to the next question that focus on organic lipophilic compounds, and I will pass the floor to Kasim. Kasim, please.
Thank you very much, Jose. I'll have to give a slightly longer answer and give a bit of background. It is true that many or most food materials are composed of fibers or particles and are composed of various sized colloidal substances and all that. Some of them do exist in micro scale and potentially in nanoscale as well, some of them. One thing to remember that the other side of that is that even if there are longer polymers, biopolymers within food materials, they undergo digestion in the gastrointestinal tract. And it can be argued that they become smaller and smaller. And before they are completely assimilated within the digestive system, they potentially pass through a nanoscale. So it can be said that, oh, what's the difference? We already have this system where material, the things happen at nanoscale. And this is the crux of this question. The difference is that in the food case, food materials case, those materials are dealt with by the body through digestion, and some of them are absorbed and the others are excreted, eliminated. Here we are talking about those substances, those materials that are either made at nanoscale or they have a significant nano fraction in them through the production process. And because we know that the properties, behavior, and biokinetics of those particles, when they are at nanoscale, raises certain concerns. So those concerns have to be addressed in a risk assessment. So it is not equivalent to a natural food material, which goes through a process in the body. Body is already used to it. has a system of degrading it, absorbing the required nutrients, and eliminating those which are not. Here we're talking about particles, materials that are already in the nanoform, that can escape the gastrointestinal system, that can enter into other cells and tissues potentially, and their biokinetics, their behavior, their properties may be different from the other ones. So okay, so that's all.
Thank you very much, Kasim. So we will move to the next question. It's linked to the appraisal rules for solubility, and I will pass the floor to Francesco.
Thank you very much, Jose. So the question is about the discrepancy between the solubility threshold, which is given in the guidance of technical requirements, and the solution test, which is also described in the same guidance. So which criterion is to be used? As a matter of fact, the solubility test is a rather simple test to be implemented, so it is suggested as a potential starting point, as the first appraisal route. But it is sometimes it may present some technical challenges, or for any other reason, the applicant is free to directly move to the second approach, which is the dissolution rate test. So it is an option of the applicant to either jump to the second test and directly test the material according to this one. So it is really a matter of the type of material and how a test can be implemented. In any case, information about the dissolution rate is absolutely essential, because if this assessment route is not met, so the criterion linked to this assessment route is not met, the material should be investigated in terms of number-based particle size distribution. So the quick answer is solubility is generally the simplest way to start. If these present challenges, or if the applicant wants to directly point to the second test, the dissolution rate, this can be done. Thank you.
Thank you very much, Francesco. So we will move to the next question. If there is experience in application for nanopesticide, this is for EFSA, so I will respond. As you know, in the area of nanopesticides, well, in the area of pesticides in general, there are two different assessments. What it's called a biphasic system. The active substances are assessed at EFSA level, that we do the peer review for the risk assessment produced by the rapporteur member states, while the formulated products, the plant protection products, are assessed at the national levels in the three zones that have been established in the legislation, North, Central, and South, or a common assessment for in some cases. In our experience, we have no specific applications for active substances, at least not that we have received now, maybe in the future. But also based on what we know of the evolution, we are expecting more of these applications in the area of nano-formulated products. And then what we are doing is to try to support the assessment by the member states. We receive a request from the Pesticide Study Network to produce guidance for the member states. So the guidance is applicable to pesticides the same way that's applicable, for example, I saw in the chat, to feed additives. In both cases, obviously, the question is if the residue in food is nano or is not nano, and this is addressing the guidance. But regarding the applications, what we expect in the area of pesticides, of nanopesticides, are applications at member state level. So you will need to consult the authorization process on the web of the European Commission that compile all the information on the plant protection products that have been authorized at member state level. Can we move to the next question? we assume that for this question, the tier regulation means the technical request, the technical guidance. But in any case, what I want is to clarify, and again, I will respond to this question: what is the interpretation of the guidance by when the guidance are applied? We are using the same rule that for all the EFSA guidance. If there is no other indications, the guidance are applicable from the time of publication. Before we are trying, particularly after the public consultation, we are using the scientific knowledge, but not the guidance itself. But after the publication, the guidance is applicable to all new assessments, not to the previous assessment. So EFSA will not reopen previous assessment. We have no capacity there. And also that depends on the sectorial legislation. Different sectoral legislation include these processes for re-evaluation or reassessment. In most of the cases also is the European Commission or the member state may request EFSA to conduct an assessment that has been already, for assessment that has been already assessed previously by EFSA, but is not the decision by EFSA. So we are not going to reassess products already in the market unless we receive a request from the European Commission, or unless this is part of the normal process that is not nano-specific, that cover all the different elements. And with that, we can move to the next question. How the particle dissolve in the food matrix, and I will pass this to Francesco again. Francesco, please.
Thank you very much, Jose. This, of course, depends to a large extent to the type of food matrix. In a liquid food matrix, a particle which is made, which is soluble in the specific medium is very likely to dissolve. So it is actually a matter of time before the material is actually ingested. And in other cases, this dissolution process may be triggered more by the gastrointestinal process. But in principle, there are obvious cases where a liquid medium might be an efficient medium to obtain a solubilization of a particle. For materials which are semi-solid, or for food matrices which are semi-solid or solid, these might be more difficult to be achieved, but in principle, changes and modifications of the physicochemical properties, including the size, may take place also in this type of matrix. So it has to be evaluated on a case-by-case basis. Thank you.
Thank you very much, Francesco. So we can have time for one more question. Within this case is linked to the nano definer. It's very important to have tools, and I will ask Uber to respond to this question because it's part of the responsibility of GRC. Yeah. Uber, please.
Yes, thank you. So first of all, yes, the nano definer e-tool is available. But second, please keep in mind that this e-tool was developed to help the users to decide whether a material is a nanomaterial or not, according to the European Commission's definition of nanomaterial. And therefore, it is relevant for the risk assessment guidance here, only insofar if the user would like needs to decide whether it's nanomaterial or not according to this definition, and therefore, and not for the nanomaterial definition in the novel food. So it was not developed to be in line with the guidance discussed here. However, it would be relevant for nanoforms according to the REACH annex, and that would be in the case of the guidance discussed here, section 1.3.c, in plant protection products that nanoforms according to the amended REACH annexes. Only for this, it could be helpful for the user, but so please keep this in mind. Maybe it's also interesting to know that, well, most of you are aware that a new definition of nanomaterial will be published very soon, and the e-tool will be updated to be in line with the new definition. So, but please, it's only for the definition for the European Commission's recommendation of a definition of nanomaterial, and not for general use within this guidance here. Thank you.
Thank you very much, Hubert. And we will move in the program. As already indicated yesterday, one of the elements that we are very happy with the response from some organizations that accepted our proposal for presented their own views. So we will start with the assessment of the substance that for us has been a very nice way to demonstrate that NAMs can be used and the mechanistic information is very relevant in the area of the nanoscale considerations. So it's my pleasure to give the floor to Maria Cristina Comelli from the MESIS that she will present the case for IHAT, iron hydroxide adipate tartrate. So Maria Cristina, the floor is yours.
Good morning, everybody. I'm trying now to share the screen. Here we are.
Yeah.
Do you see it?
Yes, not still in, yeah, now we can see it nicely and in presented mode. Thank you.
Good morning to everybody. My name is Cristina Comelli, and I am here representing Nemesis. That is a company that we are a startup company, and we decided to apply at EFSA for the risk assessment of a novel engineered nanoparticulate iron form. With the intent to mimic the dietary ferritin mechanism of action as well as its iron distribution. This is the first approved novel food in nanoparticle as a novel source of iron in food supplement. In my presentation, I'm not going into the methodological detail of this application, because the success per se defines that we went successfully through the guidelines. What I would like to show you is why, according to us, nanoparticles are very interesting in order to release nutrients to the population, and they are safe. Speaking about the regulatory legal framework, it was into our application. IHAT is a novel food, so we went through the safety assessment according to the EU regulation 228. IHAT is a new source of iron, so we had to demonstrate bioavailability in the context of Directive 46 on food supplement, and IHAT is an engineered nanomaterial according to the definition of the regulation 2203, and it is intentionally produced for having one or more dimension in the order of 10 nanometer or less. And in our case, when we will go to the phase size distribution of our product, we will see that we have 90 to 98% of the nanoparticulate form, and with nanoparticles that are spherical in forms, and with a mean particle size that is in between 2 and 5 nanometers. Within the application, we presented the IHAT in compliance with the EFSA guidance of novel food, of course, on the safety evaluation of source of nutrients and their availability. And so as concerned the risk assessment, we were compliant with the guidelines issued in 2018, because we submitted our dossier in 2019, but we are the first example, I would say, of the need of implementing the submitted data in agreement with the implemented 2021 guideline. Where we currently stand, the process is not completed. We received the positive assessment for the safety of the new novel source of iron, and our intention is to use the novel food in food supplement up to a IHAT content of 100 milligram, which means a maximum dose release of 36 milligram of iron. But of course, the final dosage will need to take in consideration the permitted levels at the national and in the member states. So we are currently undergoing the authorization process to enter the market. The lesson one, that is also taking in consideration the challenges that other colleagues yesterday presented. For sure, it is absolutely relevant to build a network of excellence in the field of the knowledge of methodology of nanoparticles, and I'm presenting you the true person responsible for our success, starting from Professor Jonathan Powell. He is a renowned researcher in the field in the nano world, and particularly in the development of novel form of release for mineral in nanoparticles. Nuno Faria is the chemist of this application. He was the one setting up the production process and then also transferring the process for the industrial scaling up. Dora Pereira is responsible for all the clinical assessment for the safety of IHAT. Katarina Kessler was helping the so-called Cambridge group during her postdoc stage in Cambridge, and now is part of Nemesis staff. Federico Benetti, you had the opportunity yesterday to look at some methodological approaches that were taken with IHAT. For sure, it was quite functional in the testing of IHAT nano identity, particularly when it comes to the gastrointestinal digestion and the demonstration of dissolution and dispersion of the product in culture media. And Patrick Coppens, Nemesis is made of people coming from the pharma environment, and we decided to enter the food arena. So surely we needed to have a substantial support from someone knowing very well the regulation for novel food, as well as all the procedure for EFSA and the European Commission. So first of all, our thanks to all these people. What is IHAT? IHAT in principle is a concept, and it is defined as a ferritin core mimetic, mimicking the structure and the gastrointestinal speciation of dietary ferritin. So the concept was ambitious in that we wanted to propose a paradigm shift in iron supplementation by means of the release of iron with nanoparticles. And the rationale comes from the lack of biosimilarity of currently conventional material in food supplement to provide iron that were reported in time to provide unwanted side effect because particularly of their pro-oxidant activity. What IHAT is intended to do is to prevent and treat nutritional iron deficiency and iron deficiency with anemia, possibly without the side effect that has been reported up to now. So here, how IHAT was made. So we started from the nanocore of ferrihydrate that was doped with dietary ligands, with organic acid, in a particular production process that we will see in a while, and the intent was to be bioavailable and safe. How nature inspired the formulation of IHAT. If we start from iron in nature, the geological form of iron, we are speaking of a ferrihydrate. This is an hydrous ferric oxohydrate nanoparticulate form that is quite crystalline in presentation. But nature in meat and in plant-based foods in the human diet, as well as in its physiological form of iron storage within the cells, is in the form of ferritin, that if you observe, it is a destabilized structure in that the nanocore of the ferrihydrate is made more amorphous by the encapsulation into proteins. This was suggesting the possibility to generate, and this is IHAT, a destabilized structure where the ferrihydrate nanocore was made amorphous by the introduction of organic ligands in order to increase bioavailability. This is the patent, the initial patent covering the formation of IHAT. So IHAT is produced by chemical synthesis, and it is the results of an acidic solution in which iron chloride, tartaric acid, and adipic acid, used as a manufacturing aiding buffer, are neutralized through the addition of sodium hydroxide. This allows the precipitation of nanoparticles. Then the product is precipitated, recovered through physical separation processes, and dried. The hypothesis was that acting in this way, we were able to provide a nanoform with high bioavailability of iron. This is the proof of concept, the initial proof of concept. And of course, EFSA is acting on demonstrating the safety of the novel food, but the data that we provided into the application are also supporting the efficacy of the product somehow. You can say in this case that in animal that were iron deficient, the oral administration of a crystalline form of nanoparticles or of a destabilized structure was really impacting on the bioavailability and on the recovery of the level of hemoglobin. What we have done is to characterize then the mechanism of absorption of the compound that is going to be taken up via endocytosis by duodenal enterocyte, as it is shown in the literature for dietary ferritin. And here you can see the electron micrographs of the intake of IHAT. The mechanism of action to respond to an enterocytic and endocytotic intake was then pharmacologically demonstrated against the use of proper inhibitors of endocytosis. So at the end, taking in account the guidelines, the implemented guidelines when it comes to the definition of our engineered nanoform, you can see that IHAT is surely a nanoform. These are the median diameters of the primary particle size. Then you will see, you will have an overview of the methodology that we have used in order to characterize the novel food. And when it comes to the physicochemical characterization, including solubility and dissolution degradation rate, the application contains all the evidences that has been proposed in these 2 interesting days for the characterization of the nanoparticle. So at the end, what we can say is that IHAT is intaken exclusively within the enterocytic intestinal lining, and it is dissolved into the lysosome. This has been proven. So what is this meaning is that IHAT is a new form of release of iron to the cells. Then, when it comes to the lysosome, the iron released from IHAT enters the common labile iron pool, and from that point and ahead, it is under the homeostatic control for iron release upon increased iron demand by the body. And also, what we have demonstrated is that through this path, there is no systemic access of the nanoparticle because everything is led by the export through ferroportin, as it has been shown for other iron forms. So the conclusion was that that IHAT, it's a nanoparticulate iron. It's uptaken by endocytosis, similarly to dietary ferritin and differently from conventional material included currently in food supplement that instead are using specific divalent metal transported at the cell membrane. And the iron is then intracellularly released. There is no systemic export. The iron is then or the nanoparticle. The iron is then systemically distributed according to iron demand through ferroportin. So it's adhering to the physiology of iron metabolism. One of the most relevant demonstration we had to provide is that there is no IHAT nor either iron from IHAT accumulation, bioaccumulation into tissue. This was done within the 90-day subchronic toxicity assessment for IHAT by means of a satellite study where iron content that was assessed either by ICP as well as by histochemistry, specific histochemistry, was compared at 28 and 90 days. And you can see we never found bioaccumulation into the intestinal mucosa, in the Peyer's patches, in the mesenteric lymph nodes, not in liver, not either in spleen, after 90 days of dose feeding. This is interesting because this was done for IHAT as such, and of course, given that we are a new and novel source of iron, it was also done in comparison with what is regarded currently still the golden standard for iron supplementation. Interestingly, we found that from iron sulfate, some iron accumulated in liver and spleen. What is about the EFSA clock? And this is the impact that we had during the risk assessment because of the need of implementing our data in line with the implemented new guideline. So we filed in December 2019. You know, the EFSA claims the 9 months are needed for closing the risk assessment and the NDA panel to issue the final scientific opinion. And what is relevant in here is to see where an applicant needs to worry somehow, I would say, because we received some clock stops along with the risk assessment. We had the first request of information, which means to provide new data that were not initially presented within the application. And this is mostly related, I would say, to the characterization of the novel food and of the nanoparticulate food in particular, within the need to provide good data, convincing data for dissolution and dispersion in culture media at the concentration that are expected to be the one at which the population will be exposed. This was done. It requested 2 months to provide the new data. Then we have a request of clarification. When it comes to the offers of EFSA, I have to say that when you receive a request of information to go through, the clarification teleconference is outstandingly useful, because at the time you have a direct confrontation also on the technical approach to solve the issue you are exposed to. And then we went through simple request of clarification, I would say mainly administrative. And then we received another request of information that was quite relevant because it was proposed to last 6 months. And that was exactly what has been discussed in this day. So we needed to provide data of size distribution in the special state of the test material in the culture media and with the most updated level of knowledge. At the end, what I have to say that it is true that from the first request of additional information, 9 months was needed to EFSA to conclude the risk assessment. Overall, by our side, 18 months were needed for the whole procedure. This is to say that from a certain point of view, when we were requested to implement our application, the new 2021 guidelines was not published yet. So it was for us a sort of surprising back to the future. But I have to say that instead, that was a great process, because in our view, the overall application at the end was absolutely more scientifically sound than in the beginning. No, I think that I am wrong. I'm going back. Okay, so the other lesson learned, I will not enter into the scientific, into the methodological details, for the very simple reason that these were presented yesterday by Federico Benetti, but the consistency of all the nano data presented into the dossier needs to be really perfect. And in here, for example, particular attention needs to properly, in our case, to properly bridge physicochemical and nanospecific properties of the original lab batches that were used for the ADME studies, the first clinical batch that was synthesized to enter into the study that you will see in a while, and the commercial batches as intended to be placed on the market. This was an extensive new study to be faced with, but it was absolutely relevant to demonstrate that any single data provided to EFSA to support the safety of the novel food was based exactly on the same material that will be provided to the general population. So this additional requirement was a throughout characterization of the physicochemical characteristic of the novel food through all the batches that were used in time into the application, which means the so-called Cambridge lab batch that was initially transferred to a GMP CMO that was Sterling. And then we have to demonstrate the substantial, let me use this term, equivalence of all our commercial batches as intended to be placed on the market. And the similarity was demonstrated. And the other step was the detailed assessment of IHAT dissolution in an in vitro gastrointestinal assay that was run either in fed as well as in fast condition at different dosages of iron and of IHAT. And also in this case, we had to demonstrate by electron microscopy the particle size distribution remaining similar to the pristine material, and also to provide evidence that nothing was changed within the environment of the nanoparticle by ADX. So from a general point of view, the methodology IHAT characterization was implemented during the risk assessment to comply with the updated 2021 guidelines. This is an overview of the methodology that were used into the application. I am not entering in any detail now, but for sure open to share experience, methodological experience with those applicants that would like to follow our experience. In addition to the original STEM, now we need to take in consideration a general approach by TEM and ADX to base the number-based distribution in media that were used for GIT dissolution assay, and the genotox, the culture media, were the one of the genotoxic assay to exclude agglomeration and maintenance of pristine characteristic. And relevant was also to demonstrate cellular uptake within this study. Listening to this today, I would say that electron microscopy is for sure one of the approach absolutely relevant, at least in our application, to support any single or relevant detail for characterizing the nanoparticle.
If you can please conclude.
Yes, and this is the overview of the safety data that were provided. So we needed to have a micronucleus test that was done in Calab, a mouse lymphoma cell assay, the 90-day repeated dose oral toxicity. I am proposing you the cross where these studies were done because they are experienced in the field of nanoparticles. And then we provided safety, human safety, through 4 clinical trials where the dosage that was tested went from the 20 up to 60 milligram of iron equivalent. I would say that now, okay. I would thank you, and I'm here for any potential question. Thank you.
Thank you very much, Christina, for your excellent presentation. I think it has been a case of high interest for us as well. I will pass the floor to the last but not least presentation, the guidance focus on regulated materials, but also there is an issue of nanoscale contaminants as well. There was also in the chat some questions regarding nanoplastic that is, you know, are of high relevance these days. And it's my pleasure to, so Maria Cristina, you can stop sharing. Yeah, thank you. So I will pass the floor to Michael Suman from Barilla that will present the approach on nanoparticles in food and safety environmental control.
Thank you. Thank you. And so thanks to have invited me in this very relevant event. I would like to thank all the organizer of EFSA. And I hope in the meanwhile you can see my screen. I'm trying to move it in presentation mode.
Now it's in presentation mode. Perfect.
Okay, perfect. So once more, thanks again. My name is Michele Suman, and I'm the head of the in Barilla company. And the next 15 minutes, I will illustrate to you an approach that we developed together in synergy with University of Parma about the assessment of nanoparticles within the wheat chain, in particular, combining information from the field and from the air around the field of growing of wheat until the transformation to pasta. And I would like just to start saying something about the difficulties in this field to look for a good side and, let's say, dark side of the science and the discussions around nanoparticles. We had in the last 2 days many occasions to discuss with the previous speakers about very important aspects, like also the last one about the iron for the body, or like in this case, the milk fortified with calcium nanoparticles. So there are many opportunities in the food sector for nanoparticles application. At the same time, talking about dark side, there are some kind of issues, some kind of worries. Some of them we were also discussing in the previous hours and also yesterday about some risks, also like in this case, talking about the decreases of intestinal barrier function that could be associated with some effects from the nanoparticles themselves. And in general, I would say there is a good, a dark, and a confused side of nanoparticles, because you can find in the media, in many kind also scientific papers, many different kind of information. So the point from the perspective also of the food industry, and also in terms of preventing and assessing the safety, is to try to be as much as possible, let's say, pragmatic, but also robust in the assessment and in the evaluations. And I don't want to go into details about the health implication, because we have already discussed in the last days about the aspects of the impact of nanoparticles on the body. And in particular, I would like just to put the attention on the inorganic nanoparticles, such as metals and metal oxides, which are, at least for what we have seen in the wheat chain, the most relevant issues that we can have within this specific topic. And nanoparticles is also a matter of identifying possibly the origin. We should consider the fact that we have natural and anthropomorphic sources that can come from combustions, from abrasion, etc., from the fallout, and at the same time also food constituents undergo to structural changes due to the food processing itself. If we consider milling, homogenization, other kind of food processing that can, not always, but sometimes goes to transform the food constituents up to the micro or the nanoscale. At the same time, we have also to take into account that some digestion processes can progressively go towards smaller components at the same time. So generally speaking, sometimes can be very difficult to distinguish between particles that can be initially and deliberately engineered and some that can come also from other natural sources. When we consider our sample preparation approach, we were looking to different kind of chain and different kind of raw materials and food products, even if the presentation of today will be focused on wheat and durum wheat chain. We were also looking to cookies and other kind of bakery products at the same time. So we tried also to set different protocols combining pre-cooking, defecting, and enzymatic treatments and membrane filtration only and when necessary. And you have here in front of you a scheme of the different potential treatment that can be done in terms of enzymatic or not treatment, defecting or not phases, depending, as I said, on the specific kind of category of product in object. If we consider specifically the aspect of the durum wheat pasta production chain, in this case, the protocol also in the direction to avoid potential artifacts was set at the end in terms of sonication, immersion in milky water, and then direct filtering of the correspondent, let's say, suspension into dedicated filters that can be identified here if you would like more details about their characteristics. In the idea, so to collect the different particles on these polycarbonate filters and then have the possibility to analyze those filters in two main different ways. One by electron scanning microscopy, the other in a sort of overall evaluation through an ICP-MS combined approach. The first one, ICP-MS, inductively coupled plasma mass spectrometry, has been executed after having mineralized part of the filter by microwave treatment. And then the method was validated in terms of main parameters, linearity, quantification limits, etc., according to European guidelines. So this was practically dividing in two parts the polycarbonate filters and, let's say, having half of the filter dedicated to this ICP-MS analysis, and the other half dedicated to correspondent inferences and investigation by ISM, FEG, EDAX analysis. So we executed scanning electron microscopy in backscattering modality, and we were isolating and identifying the different metals particles localized in bright zones in this way, either by manually evaluation, but also considering some dedicated software for automatic particle counting and identification, and comparing also the result from the manual and automatic counting at the same time. We achieved in this sense these results. You have here some example of iron particles or titanium particles that were identified on the wheat or on the pasta matrix by the ISM approach. And in general, what has been found was that the largest number of particles that was found in the chain was mainly made by iron, whereas sometimes titanium or copper or zinc were occasionally found. If you look to the next images, again, you can see particles that were also identified starting from the wheat ear until to the correspondent pasta obtained at the end of the transformation process. And if we would like now to go into more details of the study, we were also looking to different, let's say, cultivation that has been executed in a field not far from the motorway in Parma, so between the production plant of Barilla and the motorway, and different varieties of wheat were cultivated beside one each other in that place. And an interesting first finding is represented by the fact that in pairs, two varieties, Svevo and Aureo, and other two, so-called Pi Greco and Normanno, were combined in terms of content of nanoparticles and general particle presence on their correspondent ears in two different ways. You can see that the Svevo Aureo was accumulating much more nanoparticles than the Pi Greco Normanno varieties. And there are some potential explanations for these results. From the agronomical genetic point of view, Aureo and also Svevo are typically very close. And also this is because Svevo was progressively developed by, let's say, this cultivar selection. And Svevo and Aureo generally grow quickly. So we have at the end of the cultivation that the Svevo and Aureo plants were longer and more extended than the correspondent Pi Greco and Normanno varieties, about 50 days under the atmospheric condition for the growth. And furthermore, the Svevo and Aureo were exposed in the wind direction, in the direction of the motorway, and also the thermal incinerator that is present in the Parma area around. So all these different aspects we were considering as an explanation of this higher accumulation in those two varieties that were harvested in the same moment of the other two ones. If you look to the different steps of the chain, practically moving from the wheat and the correspondent semolina and pasta products, considering the two different functions, one lower than 800 nanometers and the second one lower than 150 nanometers, practically the particles were mainly made by iron, as said, and a very lower number of particles were represented by titanium, aluminium, chrome, etc. And the same results in terms of qualitative identification were also confirmed by the correspondent ICP-MS analysis respect to the counting and identification obtained by the electron scanning microscopy. The final outcome is a depletion of micro and nanoparticles along the chain if you look to move from the wheat itself to the finished semolina and pasta product. Then, if you look to the air around those places, airborne particles were sampled in the same area, and the study was executed for 4 consecutive seasonal monitoring periods. sampling the air through an 8-stage cascade Anderson impactor for 70 hours along 5 weeks, distributed through these 4 consecutive seasonal periods. In this way, we were able then to gravimetrically evaluate the number of particles obtained at the different stages of the cascade impactor for the different season. And we were able to again isolate, identify, and count those particles and also to gravimetrically evaluate them at the different stages in the different seasonalities. What we have learned at the end is a confirmation of what found in the wheat chain, because particles were mainly represented by iron, but in this case we have found also presence of magnesium and lead, probably also connected to the motorway. And as you can see, this is the composition obtained that is similar if we look to the fraction lower than 800 nanometers and the fraction lower than 150 nanometers. Again, the results were also confirmed by correspondent ICP-MS analysis on the filters obtained by the different stages of the cascade impactor. We can also say that the particles in the, let's say, smaller dimension, lower than 150 nanometers, represent practically around 80% of the total that were accumulated and counted through the different stages of the impactor. And a final point is that comparing the different seasons, during the autumn winter, the contribute that is represented by the finest fraction of the total airborne is practically doubled than in the summer period. And also the ratio between the particles collecting the first stages of the cascade impactor with the first to the last ones increase from the spring-summer to the autumn-winter period. That is another interesting information that we collected during the study. So coming to a sort of completing the puzzle, we can say that the micro inorganic and nanoparticles assessment also for the future imply the need to combine information that has to come from the environment and also from, let's say, the raw materials to the finished products in the different food chains, trying to set protocols that has to be harmonized, reproducible, and accurate. And in this sense, we think that combining ICP-MS and electron scanning microscopy EDAX information together could give combined final outcomes in terms of characterization and quantitative analysis of these inorganic particles in complex food matrices and chain. We can say that specifically talking about the durum wheat to semolina and pasta chain, there is a decrease of the concentration of metal particles that substantially indicate an external contamination, a fallout from the environmental area, air, with respect then to a decrease due to the cleaning, the branding, and corresponding food processing stages until the final pasta product. And finally, we can say that also it has been made a further evaluation, also the different distribution of the particle during seasonal periods for an entire year, having more information of the scenario that is probably the scenario which is due then to the correspondent contamination along the chain itself. And with this, I would like to leave you with some bibliographic references of some of the published studies about the work that I presented to you today. And I would like to thank you for your kind attention, and I'm available for any further questions. Thanks again.
Thank you very much, Michele, for the excellent presentation. I think it's very good to see that what I introduced today, that this is shared responsibility for everybody to ensure the safety of the consumers is taken very seriously. I think that will be very good to see that we can also, many of the elements of the guidance, even the guidance is only for regulated products, can be applied in the area of contaminants. As already mentioned, we are planning to have this again. I do not see specific questions in the chat for the moment. So thank you very much.
Thanks again.
And we will go to the last question and answer session. If during the question I see a specific question for Christina or for you, we will ask this to you, and we will pass. Thank you again for the presentation. So back to the question and answers. And I think that one of the key elements here is to try to finalize. If we have the first question, while Irene is trying to put this in the and to share the screen, was
Yes,
yeah.
Not yet. Now
It's coming. Perfect. So
okay.
Thank you very much, Irene. I will try to use this question to clarify. Obviously, we have a reassessment of substances based on regulatory requirements, based on new data. That's covered the nanoscale, but also many other areas. There are new requirements in the legislation or adaptation of the OECD. But the intention here is not to see how many substances have risk or not. The intention here is to be sure that consumers are protected and are protected according to the best standards for food safety risk assessment. We cannot provide numbers now because the guidance has been published only a few months. Obviously, we will see how many substances or materials in the EFSA assessment require nanoscale consideration. So the ones that require nanoscale consideration, we'll say, are much more than initially expected. When we start to request specific information, we see that is very important. And then the question is to ensure that the safety assessment covered this fraction of nanoparticles as well. It's not a hazard search, so we are not searching. We are ensuring that the risk assessment that we are conducting are covering all the elements, including this fraction that have different properties than the material that has been assessed before. And with that, I will pass to the next question. With this related to the way of to do the exposure assessment, and as mentioned in the guidance, this is we need to integrate the nanoscale and the sectorial legislation. So I will pass the floor to Roland and to Francesco, that are our experts regarding food content materials and novel foods, to give some indications on this area. So I think there was Roland should be first, and then Francesco. Roland, please.
Yeah, thank you. Can you hear me? Yeah.
We can hear you.
Okay, thank you. First of all, I have to say that we are dealing only here with the oral exposure route, of course, and to explain a little bit the situation, to illustrate the situation, let me present you retrospectively an example which was already evaluated by the EFSA. I'm talking about substance titanium nitride, which was used as a reheat additive in the production of polyethylene terephthalate, PET water bottles. As you know, this titanium nitride is a substance which is fully inert, chemically inert, and not soluble in aqueous systems, and therefore it clearly directs to the risk assessment guidance we are discussing today. This case was a few years ago, and it is very remarkable how congruent the evaluation was with our today's nano risk assessment guidance. First of all, the physicochemical characterization was made both on the pristine material and also then when it was in the plastic by a chem measurement of a cross section. And we could see that these smallest particles are quietly homogeneous in a size of around 20 nanometers. So in the next step, a migration test was carried out, and the titanium was measured by ICMS, and no titanium could be detected at a detection limit of 5 ppb. So we had in that case a mass-related value, which in absence of any other approach or any other data could be used as a worst case to calculate based on the structural specifications of the material, and the density could be used to calculate a number of particles, mathematics. But as I said, in absence of any other approach, this would be the worst case. But since our risk assessment guidance is a scientific document, and I'm referring here to Appendix D3, where you find a special description of substances used in FCM, it allows also to apply scientific evidence. And what I'm talking about here, what we know about migration theory and migration modeling, and taking the matrix into account and the polyester into account, and taking the size of the particles into account. Migration modeling comes to the conclusion that no particles can be released from this PET matrix, because we can assume there that the particles are fully embedded. So and therefore no fusion would be positive for these particles. So we could apply, according to the scientific guidance, migration modeling, and come to the conclusion that no exposure will happen from water which is filled in such bottles. I hope that this gives you some answer to your question, and maybe Francesco has another example from the food area, which illustrates this better. I don't know. Thank you.
Thank you, Roland. Yes, I can try to complement this with some reasoning about the novel food area. So the question is about what type of concentration or doses have to be considered in testing. If a nanomaterial is produced as a food ingredient, meaning it is a novel food, whenever it has to be tested according to the nano guidance, instructions are given for each specific type of testing, how to select the appropriate concentrations and doses. And of course, please do not forget that mass-based concentration can always be converted to particle number concentrations. So please refer to the guidance because specific indications are given. This is valid for a cellular in vitro testing, for instance, which means, for instance, simulated in vitro digestion. And it is also valid, of course, for in vivo testing. And in this case, for in vivo tests, consideration of use levels and the resulting human exposure is needed for novel foods, and it is again explained in the guidance. And use levels are defined according to the sectoral guidance. So please do not forget that the sectorial assessment and the nano assessment go hand in hand, and so the novel food guidance defines the need to identify use levels, and this will be the starting point to identify exposure, and so also meaningful doses for the nano guidance. For in vitro testing, finally, a generic concentration threshold above which particle sedimentation and artifacts due to the deposition on the cell layer are to be expected is indicated in the guidance. So please refer to the specific chapter because directions are provided also in this case. Thank you.
Thank you very much, Francesco. We have received a question from Michele. So, Michele, if you can please put your cameras, your question, comment. If you can address this, please.
Yeah, yeah, I've seen the question, and honestly, we have not, at least in the very short period, a plan to implement a study on this corona-absorbed inorganic materials. it is something that honestly I would like to better understand and know, because this is let's say a part that we honestly do not have considered in the previous studies. So my reaction could be to invite and to stimulate scientists that are here in the audience, like in particular the one that put the question, to contact me and to give us some suggestions, some indication eventually how to proceed in this kind of study, taking into account of this sort of covering corona around the food, carbon and hydrogen compound material. This is something that really we didn't evaluate up to now.
Okay, thank you very much. So we'll move to the next question. Go back to the sonication, so I will pass the floor to Jan. Jan, please.
Thank you. From a technical point of view, in our lab, we also always clean our probe. We check it using negative control samples, and we change our probe in time. I have to also to remark that each time that we develop a sonication-based assay, we test a number of energies to make sure that it does not influence the constituent particle size. Thank you.
Thank you very much, Jan. So we can move to the next question. I think that in this case is for Christina. We have received this question in the chat relating to your presentation from IHAT. So Christina, I hope that you have been able to see it. If
yes,
you can please provide your view.
I have seen this question. So we prepared on a daily basis the threshold solution from a stored mother solution, and the intent was, of course, to demonstrate that we were providing the right dosage of IHAT with no interaction. This was a garbage study, so with no interaction of the novel food with even the tubes, any part of the administration. So this was for garbage. The mother solution was made weekly but freshly prepared every day. So as concern the genotoxicity, I would say that you would need to demonstrate your cellular uptake within the culture media used for genotox assessment, although within the application we also demonstrated cellular uptake in other cell lines, particularly in CACO2, but unfortunately for the genotox study, CACO2 are not validated cell lines, at least up to now. So we provided a comprehensive evidence of cellular uptake of the nanoparticles from the novel food in different cell lines into the application.
Okay, thank you very much, Christina. So we will move again to questions on the guidance. So the next question relates to the application in food, and I will pass this question to Francesco. Francesco, please.
Thank you very much. So this question is about the threshold for solubility, which might be difficult in terms of implementing the associated solubility test in cases of, for instance, materials which act as thickening or gelling agents, so have this type of physicochemical properties. So two cases have to be distinguished here. The first one is if the thickening or the gelling agent is truly water soluble. If it is truly water soluble, this means it does not form a suspension, but a true solution. This might make the determination of solubility technically complex. This is to be acknowledged. And this is to be addressed on a case-by-case basis with proper experimental solutions and in case resorting to other appraisal routes. I note that the fact that there are exceptions is not a good reason not to establish a guidance. So, as a matter of fact, the guidance always calls for alternative solutions where there are technical problems, if the selected option is properly justified and solid scientific data support the results, there is no problem, and this is entirely valid for the assessment. The second case is when gelling properties are conferred by the formation of a network of particles or fibers in which water molecules are included. This is very frequent. In this case, formation of a gel is not the key issue for testing, because if particles or fibers remain as such, so maintain their particulate nature, when dispersed in water, this means they are not soluble, and so other appraisal routes are needed. So please keep in mind that sometimes these gelling properties are conferred by particles of fibers which do not dissolve, and their suspension at a certain concentration provide these technological properties. In this case, the particles are by definition not soluble in the medium. Thank you.
Thank you, Francesco. Do not leave, because the next question is for you as well. It's related to the project nanocellulose. So if you can answer, and I will suggest that then Jan can also complement for the second part of the question.
The outcome of the nanocellular project is expected for next year. So we plan, of course, under the supervision of EFSA, who is funding the project, to provide extensive dissemination of the results, and this will be by different routes, which means not only scientific reports of EFSA and scientific publications, but also possibly meetings and other occasions. So we will ensure results are shared in a way also to underpin further use of NAMs in food nanotoxicology area. And for the microcellulose, I already replied about this question. There is some evidence emerging from the literature which did show that microcellulose may contain a nanofraction. So the answer is yes. And hand over to Jan.
To analyze nanocellulose, we use an EM-based, electron microscopy-based approach. We optimized a protocol to bring the particles in dispersion, coated them to a grid. We had to make sure that depending on the type of cellulose, the charge of the grid was compatible with the type of cellulose. Some are positively charged, some are not. Some are negatively charged. And then we used a transmission electron microscopy of a negatively stained preparation to make sure that the particles showed enough contrast to visualize them properly. And this approach worked both in aqueous-based and a medium-based media, culture medium-based media.
Thank you, Jan. So we will move to the next question. It is related to the toxicity and endocrine disruption. I will pass this to Alicia. Alicia, please.
Yes, thank you very much. So, risk assessment of nanomaterials, if they have endocrine disrupting effect, we are talking theoretically now, or all nanomaterials, does not differ from the risk assessment of conventional materials, because we have 4 steps in the risk assessment. And if the nanomaterial under the evaluation has the endocrine disrupting effect, then it will be assessed as such, and maybe this is the effect which will be the apical effect on which the health-based guidelines has to be established. However, what you ask, it is how this endocrine disruptor risk management confers with the nano guidelines. EFSA perform risk assessment, while risk management is in hands of the Commission. I hope it answers your question.
Thank you very much, Alicia. So we'll move to the next question, which again goes to the material with the toxicity has been assessed, why new studies are needed, and I will pass the floor to Kasim.
Thank you very much, Jose. I think this question has been answered before, but I'll try to re-answer it. No one is asking for new studies to start with. If you look at tiered approach proposed in the guidance documents, the very initial tiers are looking at what is available. And if an applicant has data already from traditional materials or old studies, then they could look into that data. What the guidance says is that you need to assess those studies and see whether those studies have already covered the particle fraction in them, or if the material was nano to start with, was there all the material characterization data available? Was properly dispersion of particles done during the test and all that? And if then you find that the existing studies cover already any risks from particles, small particles, including nanoparticles, then that can be put into a weight of evidence and submitted as part of the risk assessment. So it is not the new studies are not asked to start with. The tiered approach says that you evaluate whatever you have got, and if you feel that those studies may or may not have covered the particle risk in them. I'll give you one example. For example, you have old study in which genotoxicity hazard has been discounted on the basis of Ames test. So obviously, that would not have taken into account any particle-related genotoxicity. So these kind of things you need to look into. What is different? Is material characterization data available? Was dispersion properly done? Were some of the studies done in, or do they cover any risk from particles, hazard and risk? And if that is the case, then you can obviously use those studies. So think of weight of evidence, think of all those associated aspects that you need to consider specifically in relation to small particle characters. Thank you.
Thank you very much, Kasim. We can move to the next question, which is related to feed ingredients, and I will pass the floor to Alicia. Alicia, please.
Sorry, I had to unmute myself. So this is like it is. Somebody has wrote that workshop does not address the specifics for feed ingredients and particularly target animal safety. I'm not sure if I understand, but I think that the question goes for that we do not address the paradigm for assessment of feed additives in feed, because we do not assess feed ingredients, neither for human consumption, unless there are novel foods, of course, but we perform, for example, for regulatory products in EFSA evaluation of feed additives and food additives. So, or is this animal safety going for the laboratory animals which are used in the in vivo study? But second part, does safety extrapolation from laboratory animal studies apply also to nanomaterials? Yes, because the paradigm of risk assessment is the same for nanomaterials as for other compounds, chemical compounds, which are undergoing the risk assessment in EFSA. So these are the 4 steps. You identify the hazard, you perform hazard characterization, you perform estimation of exposure, consumer exposure, to find out which parts of the human population could be, exposed more than the health-based guidance value indicated from hazard characterization would be. And then this risk assessment is delivered to the Commission. So yes, and in the risk assessment of chemicals, traditionally we have something which is called uncertainty factors, and it is usually 100. Historically, it is 10 for extrapolation from the animals to human situation, and from the sensitive difference in sensitivity in human population, another factor of 10. And those both 10s, they consist of factors for toxicodynamic and toxicokinetic. And depending if we have more data on the mode of action, mechanism of action, on toxicokinetic, we can modify it, even this factor, that it can be smaller. Yes, and then it will be used. If we have extrapolation, for example, to derive the health-based guidance value from not no observed adverse effect level, but lowest observed effect level, adverse effect level, then we might use additionally the 4 factors for this. But yes, the factor, uncertainty factor, you call it safety factor, yes, of 100 is relevant also for the risk assessment of nanomaterials. I also would like to stress that in nowadays we are going more for calculation of benchmark dose for the calculation for going extrapolation for the health-based guidance value for consumers. Maybe Jose would like to add to this, please.
Yes, thank you, Alicia. And then we see in the chat that there's a confirmation that the question referred to feed additives. We have a specific appendix in the guidance to cover the specificities of feed additives. It's a cross-cutting guidance. The key element is consumers. So in the main guidance, what would you see is the assessment of consumers that may be exposed also to residues of feed additives, and the same principle that apply for pesticide residues applied to residues of feed additives. In the characterization of the residues in the animals that has been fed with the additive, there is important to check if the residue is as particles or if the residue is dissolved ions or molecules. In the appendix, we put specific indications also for the assessment of the target animals. So the extrapolation from the laboratory animals to the animals for which the feed additive is intended to be used are basically the same principles apply, but then you need to consider that this is an assessment for the animal, not the assessment for humans. And also in this appendix, we mentioned that in the area of feed additives, again, also in the area of pesticides, EFSA is also responsible for the assessment of occupational exposure. That means that inhalation and dermal exposure may be relevant as well. For the moment, we have not developed guidance. We are following with ECHA the guidance that they are developing for the nanoforms. And the idea is that in the future, we will complement this guidance that focus on oral exposure with indication on how to use ECHA guidance for the dermal and inhalation exposure, and also to consider how to use the ECHA guidance or to develop joint activities for covering the environmental risk assessment. And with that, we are, according to the time, I think that we have tried to cover as many questions as possible. So I will stop here, and we will move to the final presentation that, sorry, you need to listen to me again. So I will try to present some take-home messages for the assessment. Let me share the screen. So I hope that you can see my screen now. So in presentation note. So just a summary, this morning I presented the key messages from yesterday, and I will try to repeat to try to give more clarity. We are talking about conventional materials, is the evolution of the scientific knowledge. That means that yes, we have new considerations also for previous assessment, and materials are triggering new information requirements. But again, that is absolutely essential to keep the high level of protection for consumers that the society, the risk managers, and all of us wants to have. And it includes thresholds based on risk assessment, do not include definitions. It's not that we have a different definition for nanomaterials in these guidances. Are not definitions, are conventional materials, and I will want to stress this to be absolutely clear. Conventional materials, other provisions for nanomaterials do not apply, but need risk assessment at the nanoscale. And this means specific information. So we have been able to clarify this information in the guidance and technical requirements. You have different options, and if not, then you will need to apply risk assessment considerations in your guidance. And today, we have presented the guidance of the nanoscale consideration for the risk assessment. So it's the guidance for risk assessment for nanomaterials applicable to legal nanomaterials. That means in our area for EFSA, engineering nanomaterials in almost all the areas regarding food, feed additives, flavorants, nanoforms for food contact materials, and nanoforms for pesticides. That cover also the material that being conventional materials, and I want to highlight this once more, are conventional materials, but only for the risk assessment perspective, they need to have a consideration for nanofraction, and also nanostructured materials and nanocarriers. And in this case, the key elements that we have been discussing today are that in the case of engineering nanomaterials and nanoforms, there is also an intention or in the process, it's clear that those are nanoformulated, are put in nanoform for one intention. The case from IHAT has clarified that this can be very good in the area. So again, we are covering the safety, but obviously we are not saying that nanotechnology is a problem. Just the opposite. In the food and feed area, is promising advance here, also to demonstrate safety and to improve safety and sustainability through the use of nanotechnology. There are big conferences every 2 years. This year will be in Singapore of the Global Forum for Risk Assessment in Food and Feed for nanotechnologies that EFSA is part of it. And then with all other regulators in the area, we are trying to put clarity of nanotechnology, all the good elements that provide innovation and increase safety. We have several applications indicated that this can improve the process, but also improve the way that we receive the nutrients, but also the consequences that the safety assessment need to consider that. And ideal situation for us is that we can confirm that the safety of those products is very high and according to the highest standards that we have in the European Union. For the conventional materials with the nanofraction, you need to confirm that the nanofraction was part of the test material. And in all the cases, again, the issue of the high level of dispersion and agglomeration is absolutely considered in the test design. Please consider that for the testing, we need to use doses that obviously are orders of magnitude higher than the doses that consumers are expected to be exposed because of the margin of uncertainty factors that Alicia was kindly explaining in the response to the question, and that you know. So basically, you cannot say that the exposure is the same for doses that are 3 orders or 4 orders of magnitude larger than the level of exposure for the consumers, because the dose and the final concentration in the media, that is in the dosing media, obviously affect agglomeration. That's why this is an essential element. Linked to that, we need to consider the worst case conditions. That is absolutely essential. So one of the elements and the difficulty that we have in the area of food safety is that there are a lot of uses, that we have also very broad technical specification for the materials. So we may have materials with very different composition in terms of the size of the particles covered by the same specification. And we need to be sure in the safety assessment that we are covering materials that are relevant, and it's not for EFSA, it's for the applicants in some cases and for the Commission in others, to modify the technical specifications if needed to adapt to the different conditions. But at the end of the day, is the way that consumers will be exposed, and worst case is always that in the area of nano is that that consumers are exposed to individual particles. OECD test lines are obviously very important. There are a lot of effort to adapt OECD test guidelines to consider nanoscale consideration. There is a specific working party under the OECD. EFSA is part of it. Obviously, GRC is leading from the EU perspective. ECHA is contributing and is there as well. So we are trying to move this, but for the moment, a large majority of OECD test guidelines for toxicology do not cover the nanospecific considerations. So please, you have specific indications in the EFSA guidance on how to adopt this for oral studies. Confirm exposure to particles, either to cells or to tissues, and again, both for engineering nanomaterials and for conventional materials, try to use as much as possible available studies. The project that I have mentioned several times that we will launch this year, case studies like the one on the nanocellulose that Francesco was presented, will provide a specific indication on how IHATs can be constructed and how we can maximize the use of animal studies available already and complement the gaps that are needed for assessing the nanoscale considerations using non-animal approaches. I would like to just extract some of the comments from the chat. The first are related to the pre-submission, and I selected 2 different comments very similar to see that the getting good dossier, being able to provide good advice before the dossier is submitted, that is very relevant for everybody. Also, it's very relevant for us and for the risk assessors, like Alberto Mantovani was clearly indicated. So we are trying to do our best with the guidance. The specificities on how much we can enter into advice depends on the legislation and are different in different sectors. But one of the key elements for this stakeholder event was exactly to being involved in this kind of discussions, and also to facilitate the way that that we are explaining the guidance and producing case studies that maybe are published in the future. There was also a comment that will be very interested to see EFSA position for a particular substance, IHAT, titanium dioxide. There are several ongoing assessment for metals in nanoforms. Assessing the EFSA position is clear, is in the scientific opinion that has been adopted and published by the relevant scientific panel. So that's clear. You have the specific view there, but we want to use this and to facilitate as one of the elements for supporting pre-submissions. We will compile all the questions that we have received today and try to provide EFSA answers in writing. Regarding the second set of comments, we thanks a lot all of you for putting these comments from yesterday, but please, you will receive a survey. It's very important for us that you complete the survey that provide us information on how to improve next events. As already mentioned, just wait some, so we will need some weeks because we have a huge amount of questions to process, but we will publish the document. And if you have something else, you have to move to the EFSA questions. And now it's time to say thanks to everybody. So I will stop sharing, and I will start with the person that has not appeared yet, but is the responsible that we are here. So Reinilde, if you can put your camera on, please. Reinilde was my predecessor as chair of the working group. So she's responsible for the guidance, already the one in 2018, plus to support the working group. And she has accepted a new challenge, a new position in EFSA, but we want to express that we are here thanks to you, Reinilde.
Yeah,
I will, please.
I appreciate this very much, Jose. And my personal feeling for today is, having worked on these tools for like over 10 years, that now I wish to extend my gratitude also to those lab technicians and to those principal investigators that have studied these texts, which may be perceived as burdensome, but that use also these guidances with precision on their instrumentation in-house. And for those applicants that need to plan for this type of capacity building when the know-how for them is not yet in-house, I think it can be done. And you even made a very nice tool to plan with the timelines for each of the studies, so that this can all be planned and organized for, and so that the quality dossiers can be delivered. Many thanks, Jose, and the working group and everybody today. Great.
Thank you. And obviously the working group is essential. So if I will ask the members of the working group, as well as the EFSA colleagues, to turn on your cameras, please. We are here because we have two guidance, and if we have two guidances, is because we have an excellent working group on nanotechnology that cover key scientists in the area with a lot of regulatory capacity, but also TACIs with excellent capacity to coordinate scientists with the risk manager that are the one that need the final advice. So on behalf of EFSA, our thanks to all the members and observers of the working group for the excellent work that you have done, and also for accepting to participate in this event, preparing the presentations, as well as for being able to accept to discuss and to answer questions directly online during these 2 days. I will also want to thank all the presenters for today and yesterday. Also, the external presenters obviously is very relevant for us to see the view from the stakeholders. So we do not want to be egocentric. We want to see how you see us. And also for the colleagues in EFSA that have been key in the presenting the information from the applicant, for example, in the case of Sarah, and also the colleagues that are behind that have been chaotic 2 days here. I can promise, because you can see my face, but I can see beyond that the colleagues trying to put all the questions from the chat, and my special appreciation to Anna Lambergard and the colleagues from the other units, Anna Rincon, Andrea, and Eric, that have facilitated this process, even they are not been seen during this event. Also to the colleagues that are in Corsair and the event team, I will not put all the names because we have a little bit of a move between the colleagues that are supporting. We started with one, so we are finalizing with others. All has provide excellent support. Also the technical support during these 2 days, having a meeting with, we were close to 300 people in the same team's meeting with this challenge, but also for all the organization presentation. So thank you very much for the great opportunity here. Also to all the participants. So we have a stakeholder event. That means that we expect stakeholders to respond. The response has been great. Will be a lot of work for us, but obviously it will be very good to be able to provide additional input on how to do the implementation and the interpretation of the guidance. And finally, I want to thank especially to the two persons that have been following the process from the beginning to the end, to Chiara and to Irene. They were in the design in the preparation. They accepted the challenge for the presenting the guidance, and in between doing also all the support for getting the questions, checking who should answer. So if I'm glad is to be able to have selected excellent young scientists to support EFSA. So thanks to you, thanks to everybody.
And thanks to you, Jose.
Thank you very much, Jose.
Yes.
That was
Jose, thanks. Very, very good.
Thanks a lot.
Thank you very much.
All of you for joining.
Thank you. Time for lunch. I hope that you have enjoyed. The meeting is over. Thank you.
Yes, very much.
Goodbye.
Bye bye.
Thank you
Thanks
all.
a
Bye.
lot.
Bye. Thank you very much.
Bye bye,
Bye.
everybody.
Bye.
Bye.